Okay, we're going to get started. Good morning, Dr. Garcia here. I'm going to read through some script material that I need to cover before we officially start. So good morning, everyone. Welcome. You may notice board members are accessing their laptops, phones, or devices during the meeting. They're using devices solely to access the board meeting materials that are in electronic format. We have a designated time on the agenda for public comment and ask for public comment on each agenda item. I ask that you be respectful of the need to conduct the board's business. This meeting is available via teleconference. Individuals listening to the meeting will have the opportunity to provide public comment and will be assisted by a moderator who will be facilitating the teleconferencing process. For those members of the public participating via teleconference, please wait until the moderator has introduced you before you make your comments. Each person will be limited to 3 minutes per agenda item. The board welcomes public comment on any item on the agenda, and it is the board's intent to ask for public comment prior to the board taking action on any agenda item. If for some reason I forget to ask for public comment on the agenda item and you wish to speak on that item, please raise your hand and you will be recognized. Today's meeting will be run according to the Open Meetings Act as required by law. We plan to end today by 4 p.m. in time to watch the Padres beat the Dodgers.
That was not in the script.
And I'd like to introduce our Executive Officer, Gregory Pruden.
Good morning, everybody. Thanks for being here.
As we did at our last meeting in August, before we do roll call in the meeting, we call the meeting to order, I would like to begin by reciting our mission, vision, and values. The mission of the California State Board of Optometry is to protect the health and safety of California consumers through licensing, registration, education, and the regulation of optometry and opticianry. Our vision is to have the highest quality optometric and optical care for the people of California. Our values are consumer protection, integrity, transparency, professionalism, excellence, diversity, equity, inclusion, and belonging. Now I would like to call the meeting to order at 10:23. I apologize for the late delay, but I appreciate everyone's patience. Member Bragg, if you can perform the roll call.
Member Clemens. Member Dawson.
Present.
Member Sue.
Present.
Member Kleppa.
Present.
Dr. Pruitt.
Here.
Dr. Wong. Present. Dr. Bragg present. Vice President Linden. Here. President Garcia.
Present. Okay, thank you very much. Let's move on to agenda item number 2, public comments for items not on the agenda.
Take it in the room first.
Okay, any public comment in the room? Yes.
I want to thank.
Real quick, Ruby, it might be best if you come maybe to the front of the dais or tables there, because that's where the microphones are.
Okay.
Yeah, that's fine.
Just want to make sure everybody can hear.
I just want to thank Executive Officer Greg Pruden and his staff. Did a great job. Every time we call, we need questions answered for our opticians. They're there. And I also want to thank and acknowledge all the private practices and the large RDO firms because they're helping us recruit more into diversity. We still have a long ways to go, but I want to thank all of them publicly. And also, it's been since 2017, the opticians came on board with the optometry. Best decision ever, because we can work with our objectives instead of being separate. Thank you.
Thank you.
And see if there's any comment online.
Any other public comment in the hearing room? No, seeing none. Any public comment for those that are calling in?
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you're logged in and would like to participate, click on the question mark that is inside of the square. It's typically located bottom right corner of your WebEx screen. In the text field, make sure to type in the word comment and send it to all panelists before clicking send. You can also raise your hand by clicking on the outline of a hand, which is typically bottom center of your WebEx screen. At this time, I see no request for public comment. Would you like me to close the Q&A feature?
Yeah, yes, please. Okay, moving on to discussion item number 3, possible approval of minutes. Are there any corrections or additions to the minutes as written? If not, I'll accept a motion.
I'll make a motion to accept the meetings from June 14th, 2024.
Do we have a second?
Second.
First and a second, if we can open up for public comment for item number 3. And in the room? And in the room, how about for the call-ins?
This is the moderator. The Q&A is open online. The instructions are on the screen for your reference. If you would like to participate, click on that question mark, type the word comments, send it to all panelists, or click on that outline of a hand. There are no requests. Would you like me to close the Q&A?
Yes, please. Secretary Braga, if we can do a roll call vote for the agenda.
Member Clemens? Member Dawson?
Yes, aye.
Member Sims?
Aye.
Member Kleppa?
Aye.
Dr. Pruitt?
Aye.
Dr. Wong? Aye. Dr. Bragg? Aye. Vice President Linden? Aye. President Garcia?
I vote aye. Thanks very much. So we'll move on to board agenda number 4, board president's report. So discussion and possible action of 2025 board and committee meeting calendar.
Real quick,
Yes.
if I may, what I'm seeing on the screen right now is not the correct slide. So moderator, if we could, we're showing the PEC slides. Let's just give it a moment and we'll get caught up there, I think.
Sounds good.
Here we are.
Good, go.
Yeah.
Okay, discussion and possible action on 2025 board and committee meeting calendar. Members, in this item, we are just considering our 2025 board and committee meeting calendar. In your packet is a proposed meeting calendar that Vice President Linden and I worked together on, along with Mr. Pruden. Setting the calendar today allows for the staff to secure DCA resources for 2025. There are also a couple of highlights to mention. Except for the meetings proposed on February, we are proposing to meet as a board in April, July, and October, with committee meetings as necessary in the months of May, August, and November. As 2025 is our sunset year, it is likely that those legislative hearings will be conducted in March, consistent with the prior 3 years. Following the sunset hearings, the board will need to respond to legislative questions, and the board meetings proposed for April would be the meeting at which the board would consider those sunset responses. While we won't know the legislative calendar and timeline for some time, we believe this proposed calendar will allow for the board and the ability to properly engage in the sunset process. Members have also asked about holding a meeting in a location other than Sacramento, perhaps at one of the optometry schools in Southern California. The October 2025 meeting would be a good candidate for that meeting because the students are on campus and would provide a good opportunity for the board members to learn more about optometric education, but also provide an opportunity for the students to engage with the board meeting process. Mr. Pruden and I will be working with DCA to plan this future meeting. Are there any questions, comments regarding proposed calendar for the members? If so, this is the time for discussion.
So you say we're not talking about the February?
No, I think what President Garcia was trying to outline is, except for the February meeting, the February meetings are the only meetings that have the board meeting and the committee meeting in the same month, and they're back-to-back weeks. All of the other meetings we've tried to spread out a little bit more so that the committee meetings are meeting the month following the board meeting. But this is a proposal, and we want to take this time, if possible, to see if there's any conflicts that members are aware of regarding these dates. And if there are no conflicts, we would happily entertain a motion to accept this meeting calendar.
You making us meet on Valentine's Day?
Well, I think the Friday before that is Super Bowl Sunday.
We had a choice.
So there was a choice to make regarding.
This is the difference between people who watch football. I wouldn't have known that.
I thought you were going to say this is the difference between men and women.
That difference. But it's also the Friday before a long weekend.
That is true. I think, some of the consideration here with that early meeting was the last couple of years we've been meeting in January.
Yes.
And we also have a meeting in December. So that's a very short turnaround time between two meetings. But then I think really it was more thinking about the sunset calendar. It's very, very likely, again, just looking at the last 3 years, sunset meetings have all occurred around the first, second week of March. And so assuming that that would be a similar timeframe that the legislature would conduct those meetings at, it would make sense to have it doesn't make sense to have a meeting in March is what I'm sort of essentially saying. It would make more sense to have a meeting before that and then a meeting right after that so that we can consider what was discussed during sunset review. So that's a little of the context as to why we have those meetings in the months that we have.
Any other comments from the board? Concerns, conflicts?
We've also, I think historically had a board meeting in August, and that's been challenging for some members because of back to school, and so this proposal does not have a board meeting in August, but would have one would have a committee meeting in August. I think much like we're meeting today, which was a meeting that was not originally planned, we should keep that open as a possibility, especially since it's our sunset year. There may be the need to have an additional meeting to deal with issues that come up during sunset review. That's always a possibility, but that's not known until we get to that time. So we felt like this was a good proposal to establish a 25 calendar.
Thank you. So seeing no other comments, no other concerns, I'll accept a motion to accept the calendar as printed.
I'll make that motion.
Okay, we have a motion. We have a second.
I'll second.
We have a motion. First and a second. Is there any public comment from the audience in the room? No, seeing none. Is there any comments from anyone that is virtual, dialing in?
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you're logged in and would like to participate, click on that question mark inside of the square, type the word comments, send it to all panelists, or click on the outline of a hand, typically bottom center of your WebEx screen. At this time, I see no request for public comment. Would you like me to close the Q&A?
Yes, please. Okay, so Secretary Bragg, will you please perform the roll call vote?
Member Dawson?
Aye.
Member Sue?
Aye.
Member Cleffa?
Aye.
Dr. Pruitt?
Aye.
Dr. Wong?
Aye.
Dr. Bragg, aye. Vice President Linden?
Aye.
President Garcia?
Aye. Thank you very much. Okay, we'll now move on to item 4B, to commemorate our former member, Sandra Sims. Is she on?
I saw Sandra earlier on the attendee list, and it looks like she is on the attendee list, yes.
Sandra, can you hear us?
But she's not promoted yet to,
She's just on.
yeah, moderator, if you would you go ahead and promote former board member Sandra Sims, please, so that she can hear us and communicate?
Everyone.
Hi, Sandra, how are you?
Hi.
Thanks for being here.
Yeah, thanks for joining us.
Pleasure to be here.
So
Great to see you all.
Thank you. On September 24th, 2024, Governor Newsom appointed Sandra Sims to the Baldwin Hills Conservancy Board. With this appointment to the board, her service on the CSBO unfortunately came to an end. So we're very sad to lose you on this board, but Baldwin Hills Conservancy Board will definitely enjoy your participation. Former member Sims served on the California State Board of Optometry with distinction since April 2021, when she was appointed by Governor Newsom as a public member to the board. She was reappointed to the board in May of this year. I was looking forward to several more years working alongside you. We all were. Staff has prepared a commemoration, as we are grateful that Mrs. Sims has virtually joined us today so we can honor and celebrate her service to the board. I will now read for the record the commemoration of Ms. Sims. Sandra Sims, who is a licensed attorney in the state of California, who served by appointment to the California State Board of Optometry since 2021, who tirelessly championed consumer protection and access to care, especially to California consumers who could least afford it, who served on our consumer protection, public relations, and outreach committee, and the legislation and regulation committees as well. Therefore, be it resolved by the board president, Jeffrey Garcia, OD, and executive officer Gregory Prudent, on this day, October 11, 2024, Sandra D. Sims, JD, has invoked significant professional and personal knowledge to the protection of California consumers' health and safety through licensing, registration, education, and regulation of the practices of optometry and opticianry. So thank you, Sandra. We're all going to miss having you on the board and on our committees. We have all really enjoyed working with you. Thank you.
Ms. Sims, we will, we have I don't know if you can see it, I'm holding it up, but we have an official commemoration that board president and myself will sign and then mail to you. So look forward to that in the mail. But thank you so much for joining us today. And if you'd like to say any words, you have the floor.
Thank you so much. It has been truly not only an honor, but a privilege to serve with all of you. The work that we do is so important, and we have really worked so well as a team. And I have just been truly grateful to be part of this board, particularly excited about the work that we've done to provide and ensure access to everyone, and regardless of income status, ensuring that there are opportunities for everyone to get the care that they need, and then also the safeguards for children. So truly has been an absolute pleasure. I am looking forward to my new board position, just in terms of also providing that same level of service in that area to ensure that recreational access is provided to all, regardless of who the income. So looking forward to that, but we'll miss you all terribly. And you are in good hands, President Garcia. It's been an honor working with you as well. And I know you are going to lead this group in such an amazing way as you have always done as a board member. So, and just thank you to all.
Thank you, Sandra.
Thank you, Ms. Sims.
Any other comments?
Any comments from
the board?
Yes.
Oh, this is Yumi. I just wanted to say it was such a pleasure to work with you, and I always enjoyed your presence at all the meetings. I feel like you always made it a point to bring up how certain issues could affect consumers and always brought up the access to care issue. And so we'll definitely miss that, and it was great getting to know you.
Thank you.
And this is Lillian, and I just wanted to thank you for all your years of service. We really enjoyed having you on the board, and we're definitely going to miss you.
Thank you. I hope to see you all in Sacramento for big board meetings at some point. Hopefully I'll get a chance to see you all in Sacramento. Thank you.
Thank you again.
Bye, Ms.
Bye,
Sims.
everyone.
Bye now. Bye now.
Thank you.
Thank you. I'll get that signed and mailed out there. Sure.
Okay, now we'll move on to item number 5, discussion and possible action on legislative proposals for consideration to include in the board's 2025 Sunset Review Report.
Right. Thank you, President. Yeah, I'm up, huh?
Yeah.
Thank you, President Garcia and members. As President Garcia just mentioned, this is agenda item number 5, legislative proposals for consideration to include in our 2025 Sunset Review Report. We will talk about the Sunset Review Report next. But first, we need to talk about a few of the proposals, legislative proposals that we would like to include in that Sunset Report. In order for these specific legislative proposals to be included in the report with statutory language, we need to have the board approve each one of these proposals. So I'm going to take them in order. In your packet, you have the background of each issue, proposed solution, and proposed text for each issue. So the first one I will start with is 5A, having to do with the definition of person in Business and Professions Code section 3040. Presently, that code section makes it unlawful for a person to engage in the practice of optometry or to advertise or hold themselves out as an optometrist unless they have a valid and unrevoked license, California optometrist license. The problem with this statute is it does not define person. Several years ago, this board issued 21 citations against a business regarding several violations of law, including an allegation that they were advertising and holding themselves out as an optometrist. This case ultimately went to an administrative law hearing, and in that hearing, the judge ruled that the Optometry Practice Act nowhere has a definition of person. That definition of person that does not exist does not otherwise include business entity. And so by its own terms, this statute 3040 would not apply to the activities that the business was engaged in. Ultimately, the board did prevail on other allegations in those citations, one of which was the unlicensed practice of opticianry. But the judge said that if the legislature wished to define person in the Optometry Practice Act to include a business entity, it could have done so as it has done elsewhere. And so that's what this proposal is about. We would like to have a definition of person in Business and Professions Code 3040 that makes it clear that the definition includes business entities, that also makes it clear that only a natural person, a human being, can actually be licensed to practice optometry. We do not license corporations to practice optometry. We only license individuals. But we feel that by including a definition of person, similar to the definition that exists under the Medical Board Practice Act, would deal with the issue that we found in this administrative case from a few years ago. So the proposed solution to this issue would be to amend Business and Professions Code Section 3040 to say that a person means any individual, partnership, corporation, limited liability company, or other organization or any combination thereof, except that only a natural person shall be licensed as an optometrist under this chapter. I'm happy to take questions, comments from members. And again, the ask on each one of these items is for a motion to approve the proposal.
I have a question, if there isn't any in the room.
Not seeing any in the room at the moment. Go ahead, Member Kluppa.
All right. I just want to get a better understanding of what this change will mean. Only a natural person can be an optometrist, licensed as an optometrist. So what happens then if an optometrist wants to go out on their own as a limited liability company or professional corporation or some type of entity to limit their legal liability in malpractice? Does this mean that they cannot hold or cannot hold themselves out as being a professional corporation to limit their liability? They must always simply be a sole proprietorship? I just want to know what the effect of this change will have on that common business practice.
Yeah, that's a good question. Nothing in this language is intended to change the other allowances that are in the law for a licensed optometrist to form an optometric corporation or other professional medical corporation. Our optometrists right now and under this change would still be able to incorporate themselves. I do not believe that optometrists can form a limited liability company in California, but other business entities like partnerships or corporations or partnerships of corporations are all allowable. And so under present law, an optometrist that is licensed who is advertising their services fictitiously, so not under their licensed name, would require what we call a fictitious name permit. And one of the frequent ways that those individuals apply is with their medical corporation, probably specifically for the reasons that you just mentioned, to limit their liability under that corporate structure. So we don't believe that this definition change would restrict or otherwise touch any of those other areas of law that presently allow an optometrist to incorporate.
Okay. I guess, and I understand that that is the intent, that the intent is not to affect those liability protections that otherwise would be available to professionals in this area. I'm wondering if the language meets that need, because it says person. I'm looking at sub C, the proposed amendment to sub C. Person means any individual, partnership, corporation. So this limitation that it has to be a natural person certainly applies to all of these entities. Then it says, except that only a natural person shall be licensed. So it seems to say the regulation applies to every entity, but only a natural person complies. So on one hand, we have a corporation being affected by the regulation. On the other, we have an exception to that corporation, essentially allowing that person to hold this position. I'm just wondering if the language is meeting the intent. Maybe council can step in on this and give a little more background.
Yeah, so Member Klappa, we do believe the language is meeting the intent. Correct me if I'm wrong, Greg, but we copied this language from the Medical Board's Practice Act.
Correct.
So the Medical Board already has this as their definition of person, which is one of the reasons we decided to use the same language. Also, too, it would be important to remember that at this point, the board is just approving this as a request to the legislature. And so if farther down the road, too, there turns out to be issues from other stakeholders that might be affected, the legislature will have the opportunity to also amend it and raise up any concerns by such similar concerns that may arise.
Yeah,
Right.
and Member Klappa, if I could add on. Go ahead.
No, I just
Okay.
I just wanted to clarify with council, the understanding is that this language has been tested in this way in its application to other professionals and is found to be effective, right?
Yes,
correct.
Perfect. Okay, go ahead, Executive Director. I apologize.
Yeah, I was just going to add on to, perhaps for maybe additional context, that what we were talking about here in this administrative case from a couple of years ago was unlicensed activity, right? It was unlicensed activity, and because the definition of person doesn't exist and didn't otherwise include business entities, we weren't able to prevail on that charge. We believe that by changing the definition in this way, we are not harming an individual optometrist's ability to incorporate or otherwise form a business structure under existing law, but we are tightening up that unlicensed activity part of this statute by making clear, again, that business entities are included in that definition, but we are not licensing you as a licensed optometrist. Only a human being can be licensed in that way. So I think that perhaps that context of going after the unlicensed activity might be helpful.
Oh, I have no problem with the intent of the change. I just wanted to be sure we didn't go a little bit too far accidentally. That was all.
Sure.
Good point, Mr. Klappa. Any other comments?
I have a couple. I guess I feel like for me, what's kind of key is that you're looking at an entity that is holding itself out to be an optometrist or other, like a normal person might assume that this person is appropriately licensed. And we're just trying to make sure that anyone that appears that way to a consumer is in fact appropriately licensed. And I know that there are different licensing models that businesses and people can participate in, but I think we just want to make sure that if someone's holding themselves out in a certain way, they actually are properly licensed or properly registered.
Mm-hmm.
And I think part of that goes to, if you are a consumer and you think this person is licensed and registered, but they're not, and you have issues, who do you go to, right? Mm-hmm. If they're not licensed or registered with the board, what recourse do we have? And so, yeah, that's kind of my take on this. We just want to make sure that, there are multiple actors out there that are doing things the appropriate way, and we want to make sure that, that other people follow suit, because there are other people that are doing this the right way that come under the board.
Fair point.
Any other comments? Seeing none, I'll accept a motion to accept amendment EPC 3040 regarding definition of person.
Motion to accept.
First and second. So at this time, we'll open it up for public comment for anyone in the audience.
Christine Schultz, representing the California Optometric Association, here in support of this proposal. The laws were clearly intended to include business entities when you're talking about relationships between optometrists and opticians, and so we appreciate you making this clarifying change. Thank you.
Any other comments from the audience? Seeing none, let's go ahead and open it up for any comments from call-ins.
This is the moderator. The Q&A is now open online. The instructions will be are on the screen now. If you would like to participate, click on that question mark inside of the square, type the word comment in the text field. Make sure you ask all panelists before clicking on that send button. You can also raise your hand by clicking on the outline of the hand, which is typically bottom center of your WebEx screen. No requests at this time. Would you like me to close the Q&A?
Yes, please. Secretary Bragg, if we can do a roll call vote.
Member Dawson?
Aye.
Member Sue?
Aye.
Member Kleppa?
Aye.
Dr. Pruitt?
Aye.
Dr. Wong?
Aye.
Dr. Ryan? Aye. Vice President Linden?
Aye.
President Garcia?
I vote aye.
Motion
And
passes.
thank you. Now we'll move on to item 5B, to add DPC 2555.6 regarding probationary registrations for opticianry.
Right. Thank you, President Garcia. As members know, and as I believe the public knows hopefully as well, we have two programs under our board, both the optometry program and the opticianry program. And in many ways, they do not operate with the same sort of statutes and regulations. And this is an area that we've identified where there's a gap and we would like to correct it. And this specifically has to do with probationary registrations. Essentially for optometrist applicants, we have three decisions that we can make. We can approve, we can deny, or we can issue a probationary license. That is in contrast to how it works on the opticianry side, where we really only have two choices, approve or deny. The problem with having only two choices instead of three is that we have a greater population of our applicants on the opticianry side who apply with either discipline or conviction history compared to our optometry side. And so on our optometry side, we have this ability to issue a probationary license that does not exist on the opticianry side. The code section for the optometry side is printed here in your packet. It's Business and Professions Code 3091. And it authorizes, does not require, but authorizes the board to issue a probationary license to an optometrist applicant subject to certain terms and conditions. And those terms and conditions are listed in the statute. We have not issued in the last 4 or 5 years any probationary licenses for optometrists. But again, as I mentioned, we see a greater population of folks on the opticianry side who have these unique situations that they present with. We feel that having the probationary ability to issue that registration would do really two things. One, it would help us ensure that we're meeting our consumer protection mandate, but it would also, we believe, carry out the intent of the Fair Chance Licensing Act, which was AB 2138 from a couple years ago. Now, while the Fair Chance Licensing Act didn't touch too much about probationary licenses, it did had a lot of amendments that dealt with what crimes could be considered during a certain time period. It had also prohibited asking or requiring a conviction question from being answered. So we feel that having a probationary license on the opticianry side, much like we have on the optometry side, would be beneficial not just for staff in administering the licensing program so that we're being able to be more consistent in how we're applying things, but really think that it would be beneficial to, again, certain applicants who have unique backgrounds in their past where a probationary license might make sense. So to carry that out, we are essentially proposing to mirror the existing optometry statute that exists in Business and Professions Code Section 3091, and mirroring that into the opticianry statutes, which would be a new section, Business and Professions Code Section 2555.6. And the language is essentially the same that we're proposing on the opticianry side that currently exists on the optometry side. The only difference is where it says optometrist, we say opticianry, and so on. So again, this is a proposal to have the ability to issue a probationary license on the opticianry side, which is the same authority that we have on the optometry side. For additional context, and I think this might be helpful as well, optometrists were originally given this authority in 2005, and it was modeled specifically after the authority that exists in the Medical Practice Act. At that time, in 2005, opticianry was not with our board. It was with the medical board. It's unclear to me whether the medical board at that time had the ability to issue probationary licenses for opticianry applicants or not. I don't know the answer to that question. But I think it's important context that we modeled our statute on the optometry side after what existed in the med board side at the same time that opticianry was there. Opticianry came over to us in 2016, 2017, and had authority to issue a probationary license for those registrations did not come. So we feel, again, that this would be beneficial to our applicants who present with these unique situations. Happy to take questions, comments, or feedback from members on this proposal.
I had a few
Sure.
comments on this.
Sure.
I think as far as, so it's for 1A, supervised by another optician. Do we need to specify it's going to be the same class type? So an SLD has to supervise an SLD, or a CLD can supervise an SLD, or the other way around?
That's a good point.
And then also, would we want to specify that the supervising optician has to be in good standing?
Yeah.
We wouldn't want a probationary optician supervising.
Yep. Those are all fair points. Yep. Thank you. Member Dawson?
If I may, I'm sure everybody knows I'm a product of this very thing. And yes, the board did have the discretion to allow licenses on probation. It was just a task. It was a task. You actually had to go to a hearing. So I'm in full support of this with all the necessary cautions and restrictions. If a person has shown his or herself to be seeking to change their lives, for lack of a better phrase, why not? If they've gotten their certifications and they're working towards this this profession, why not? Absolutely. I'm so happy this is being introduced.
If I could just tack on to something that you mentioned just for board education, what you mentioned specific to your situation about having to go to the hearing. And so as I was outlining this, currently for opticianry, there's really just two choices, right? Approve or deny. The other option that member Dawson is mentioning was we actually denied his application, and then he appealed it. We went to a hearing, and it was at that point that a probationary license, I think, was ultimately issued. What the advantage of this proposal compared to that process is we avoid all of the attorney general and legal costs, both on our side, but also perhaps on the applicant side for their representation, so on and so forth. We also get to more timely licensure with appropriate terms and conditions in place so that the board can feel like we're still safeguarding the public and consumers. We're still giving the applicant that opportunity to get licensed, registered, and be legitimate in the field working. So thank you for chiming in on that.
And also, if you've gone through any of our disciplinary reports, the restrictions and requirements are arduous. I mean, it's not an easy probation period. There's reporting every month and every quarter and a lot of safeguards.
Thank you.
Any more comments about proposal B? Seeing none, I'll accept a motion to accept.
Sorry, Member Bragg, did you want to move to amend the proposal to include the changes he suggested?
Yeah, I guess.
If you want to give me a second to just think through a motion.
It could be something like, so we're looking at A1.
I think it's like, I move that staff amends the proposal to clarify that the supervising optician
is in good standing.
Is in good standing, and how would you say is the same class?
Equivalent class.
Equivalent class.
Yeah. So CLD supervised by CLD, SLD supervised by SLD.
And then that's enough guidelines for us to like work out the details.
I think that's enough guidelines for us to, yeah.
I think we could probably do this one motion. You guys want to do this two motions? That might just be easier.
Do two is easier?
Yeah, it's up to you.
Two motions.
Like you could move to amend it, or do you want to move to amend it and approve it?
Amend and approve.
Okay.
And just like friendly amendment to the.
Yeah.
Yeah. So, okay. So, I'm going to give me 1 second, and then I'll bring you my laptop over to you, Member Bragg. Let you read it. I'm going to.
And thanks for bringing this to the board.
Good
Nope.
stuff.
Actually, before, can I also, what about the supervision by an optometrist? I'm thinking about a private practitioner where they just have one
That makes sense too.
optician in their office. They won't.
Supervised by
Not the
another
licensed
optician or
or an
optometrist
optometrist.
in good standing.
Yeah.
Yeah, that's a good change. Yeah.
Wait, Brendan.
Yeah, that's a great point. The risk of adding on, we also have opticians that work under ophthalmologists. Right?
Yeah.
So I wonder if it should say by another licensed optician, optometrist, or physician and surgeon. Yeah.
Mm-hmm.
Cover it all. And importantly, in all of those cases, that's the license. Right? That's a licensee supervising. So.
Making me do some work today, Member Bragg.
From that paycheck.
I got it, that paycheck. Okay, how does this sound as a motion? I moved that staff amends the proposal to clarify that the supervising optician is in good standing and an equivalent and is a member of an equivalent class?
Registered in an equivalent class.
Okay, and is either registered in equivalent class or is an optometrist or physician or surgeon and approve the proposed language with the preceding changes.
Yeah.
Great. Okay, no problem. I'll just bring my laptop over to you.
I move that staff amends the proposal to clarify that the supervising optician is in good standing and is either registered in an equivalent class or is an optometrist or a physician or surgeon and approve the proposed language with the preceding changes.
Well said. I'll second that fantastic motion.
Read the sentence back.
I have a question,
Yeah.
if I can ask. That
Yes.
language that Member Bragg just said, those individuals all need to be in good standing, right? That's in there somewhere.
Yes.
Okay, I wasn't sure if I heard it.
Hold on, actually, let's change it to the supervising individual since we're adding in optometrists and physicians as also supervisors.
Yeah. They need to restate it.
Yeah. Just say, or you could just say, I move to retract my amendment, and then Member Wong can do it.
Okay.
I move to retract my amendment.
Okay.
Second.
I'm gonna make a new amendment, or
New motion.
new motion. I move that staff amends the proposal to clarify that the supervising individual is in good standing and is either registered in an equivalent class or is an optometrist or physician or surgeon and approve the proposed language with the preceding changes.
Thank you. So do we have a motion? So,
My motion.
That was the motion.
okay, we
And
have
then Dr. Wright.
That was the second.
we have a first and a second. I'd like to open up for any public comment in the audience. Please.
Make sure you state your name and, yep.
I'm Ruby from the California State Society for Opticians, and we work with colleges. This is a great solution because we are inviting a lot of different candidates to come through, and if they could just be placed in a probationary, that would be great. Thank you.
Thank you. We can open it up for public comment for those that are dialing in.
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you would like to participate, click on that question mark inside of the square, type the word comment in the text field. Make sure you ask all panelists before clicking that send button. You can also participate by clicking the outline of a hand, which is typically bottom center of your WebEx screen. At this time, we have no request for public comment. Would you like me to close the Q&A feature?
Yes, please. Secretary Bragg, if you could perform a roll call vote.
Member Dawson?
Aye.
Member Sue?
Aye.
Member Kleppa?
Aye.
Dr. Pruitt?
Aye.
Dr. Wong? Aye. Dr. Bragg? Aye. Vice President Linden? Aye. President Garcia?
Who would I?
Motion passed.
Thank you. Now we'll move on to item 5C. Item 5C is to add Business and Professions Code 2552.1 and 3029 regarding email addresses requirement for applicants and licensees.
Thank you, President Garcia. As was just stated, this is a proposal to require applicants and licensees to supply an email address to the board if they have one. Importantly, if they have one, the proposal does not require you to create one if you don't already have one. Several other DCA boards, including Board of Behavioral Sciences, Medical Board, Dental Board, Physical Therapy Board, and Psychology Board, have added requirements in recent years to their laws that applicants, registrants, and licensees provide the board with a current email address if they have one. We believe that this requirement for our board would be very useful as well, for at least a couple of reasons. It would allow the board to communicate information about changes to laws and regulations to most of our licensee and registrant population, rather than currently hoping that they all sign up for a listserv or visit the website or attend a board meeting. In addition, our examination vendor uses email to communicate with exam applicants. And when we give licensing presentations, we strongly stress that all applicants use an email address and provide that email address at every place it's asked for. But currently, it's not required that you provide it. And so if our exam applicants don't provide an email address when they're signing up, they have to provide a mailing address, and that is how they will get the exam information. A mailing address will take about 3 weeks to a month for them to get that exam information. When you use email, it's more like a week to 2 weeks. But again, we're not allowed to require an email right now. So for that reason, it's very essential that we have a statute change on both sides, that we can, both our opticianry and our optometry program, where we can require an email address to be provided. Also importantly, the email address would not be subject to public disclosure. It's not PRA-able, if you will. The language that we're proposing is included in the packet here. It is mirrored for both proposed statutes, 2552 of the business, 2552.1, excuse me, of the Business and Professions Code, and 3029 of the Business and Professions Code. And the language would say that an applicant, registrant, or licensee who has an electronic mail address shall provide it to the board, shall provide the board with that electronic mail address no later than July 1 of 2026, and it is considered confidential and not subject to public disclosure. We also want them to have to provide any changes to that email address within 30 days. This is a similar requirement that our licensees have right now when they change their address of record or other notifying information. Why the July 1, 2026 date? The reason for the July 1, 2026 date would be if this is included in a sunset proposal, that bill would most likely not take effect until Jan 1 of 2026, and then we would allow 6 months time for outreach and information sharing and education of the licensee and registrant population so that they're aware of this change. So this is a proposal, again, to require email addresses for our applicants and licensees if they have one. Happy to take questions from members about this proposal.
I have a question.
Comment.
We got Member Klepper, Member Pruitt in the room first, and then we'll go to you if that's okay.
Sure.
So I was just wondering, thinking that it's kind of a sign of the times, and that I don't think I have a single piece of information about myself that hasn't been breached and some kind of data leak. And so I'm wondering if, in the grand scheme, are we opening ourselves up to some kind of liability? The more information we gather on someone, the more we can stand to lose if it is somehow illegally hacked or breached?
So I can probably take this one. So Member Pruitt, at this point, the board does collect a variety of personal information that's probably more sensitive than an email address. For example, I'm sure the board has social security numbers, personal addresses, and is already complying with California law to protect those. So, so technically, yes, this is more personal information that the board is collecting, but in the grand scheme of things, I don't think the average individual licensee would consider the email the most important personal information that they.
I know individually it's not as important, but when you link that with other pieces of information, it can become valuable.
And it's a fair question and a good point, Member Pruitt. We would not, as we do, we communicate with licensees via email now. We do not disclose social security numbers or other personal identifying information when we're communicating with licensees. I believe our system even flags that if we try to include a social security number or other information. I'm not sure about how that works coming back to us, but our system sending out, we do have some protections in place there. You bring up a fair point because, as I think licensed optometrists know, but also a lot of other healing arts licensees are well aware, there are active and ongoing scam and hacking attempts of licensees. They happen all the time. I'm not aware of the board itself being targeted by any hacks or scams of that nature, but we are aware that there are groups and entities and criminal enterprises out there that are impersonating the board and pretending to be us, spoofing our phone numbers and doing other things of that nature. It's very serious and severe. DCA and a lot of the health boards put out a lot of information on our homepages and websites about this information. I think we have pinned to our social media Twitter account a scam alert, for example. So we are aware that stuff happens out there in the world, if you will. Again, we haven't seen, I'm not aware of any direct attacks on our accounts or things like that. As counsel said, we have a lot of private information on folks. We would most principally use email to communicate things like law changes, things of that nature, regulatory changes, the newsletter, things like that. We're trying to make sure the purpose of this is to help us get information out to our licensees and applicants in a more timely way. Give you one example. We have over 10,000 licensed opticians in the state. Less than 1,000 are on our listserv. So if we had an email for them, we'd be able to communicate a lot more information. So, but it's a fair point. I totally see your point.
So I think that perhaps, the benefits just far outweigh that risk. I mean, life, there's always, everything you do is risk in life. And so I think the benefits perhaps far outweigh that. I was just bringing it up just because, as is now, the email address is given because the actual licensee volunteers it versus it being required to give it because they have it.
Yeah. But it also does make it easier for staff when anyone's applying for a license or a registration, that if they can email them, the response time is much quicker versus if you had to do it versus U.S. mail, that would be significantly more difficult.
So the proposed language is not voluntary?
It is.
Still voluntary, right?
Well, it's
if they have
an email address, they need to
say. It says who has, is it the first?
Okay, so
who has an
electronic? So it's not voluntary, they have to give it.
No, it is voluntary. An applicant, registered, and licensee who has an electronic mail address. We're not requiring you to create one.
But if you
have one.
If you have an email address.
If you have one, you have to give it.
Yeah. If you have one, you have to give it to us.
If you have multiple.
Give one of them.
Give one.
Give one of them. Give one of them.
I just thought the language is okay. Yeah.
We modeled this language after what presently exists in Board of Behavioral Sciences.
In A and B, it says shall provide.
Right. That's right. I mean,
the first sentence of A says an applicant, registrant, or licensee who has an electronic email, an electronic mail address shall provide it. So it's conditional upon you having it. If you don't have an email address right now, this language does not require you to create one. Member Kleppe, you had a question.
Yeah, my question was, it's the other side of the coin from the one we were just discussing. Is there a reason why we don't require an email address to be provided for all the reasons the other members just mentioned? Ease of communication, ability to better and more easily transmit material to members, that type of thing. There's some reason why it's being done. Only if you have it, you provide it, versus someone should go out and get like a Gmail account or another free account to provide to the board. I only ask because the state bar does require it. So it is something that some boards do require.
It's not required because the law doesn't require it. Under present statute, I believe it's Business and Professions Code 27, specifies the information that licensees and applicants are supposed to provide, and it is mailing address. It's an address of record. There have been lots of efforts recently by the boards mentioned, and perhaps others, other sister boards and bureaus to make this a requirement, exactly for the reasons that you just mentioned. I will say elsewhere, there are a few application types where email is required. We have a few mobile optometric office, for example. When we implement that, the regulation for that package specifically requires you to provide an email address. So we already have at least one, and there may be a few other specific applications that we have that the regulations require you to provide an email address specific to that application type, but we do not have a statutory code section that requires it generally. So the simple answer is that the statute that requires you to provide the information that you're required to provide does not include email address presently. The reason why we don't want to amend that statute, BPC 27, is because it does not apply just to our board. It applies to a lot of other boards and bureaus, and we wouldn't want to step on their toes and require an email address for their applicants. So that's why we place it, we're proposing to place this in our specific practice acts. Did I answer your question?
You did, because this is a proposal to amend that statute, and you're saying it would have a broader effect than just our board members, right? Or
no, I thought you were asking why it's not presently required, and I was the answer to why email is not presently required is because there's a BPC, a Business and Professions Code section, again, I believe it's 27, that applies to lots of different boards and bureaus in the department, not all of them, but lots of them, and it specifies what information must be provided. I think phone number is part of that, address of record is part of that, email is not. The programs that have recently amended their laws to require email for their applicants and registrants have done it specifically in their Practice Act, because if you do it in 27, you are impacting more boards and bureaus than just yourself, and that wouldn't be appropriate.
Okay, but the BPC section you're citing 2552.1 and 3029 are specific to those that this board oversees, right?
Yeah, we are proposing to add those two code sections, 2552.1 and 3029. 2552.1 would be on the opticianry side, and 3029 is on the optometry side.
Right. So if you're adding to those code sections, would it be in conflict with the section 27 requirement to say just for our members, they need to provide us with an email?
No, we're not proposing to amend or otherwise touch 27, so there'd be no conflict.
Right. So we could add that if we wanted to. And my question is, why are we not considering adding that? That it be compulsory and not voluntary?
Adding what to where? I'm not following you.
We have two sections.
Have to get an email. Oh, because I don't know if it's appropriate for the government to force people to sign up for a certain thing like an email. And I think that would be more controversial if we were I mean, you might ask me how many people out there don't have an email address right now. I would suspect the majority of folks do, but I think it has been more of a concern in the past, not for our board, but for other boards that have gone down this route. If you're mandating somebody to get something they don't have, like an email address, that might cause some questions from the legislature. It might cause questions from stakeholders. And so our design is to try to be consistent with the successful efforts that have been done by other healing arts boards, which just require you to provide it if you have it. And I think, again, in most cases, most people have it. But to compel somebody to sign up for an email address is not something that that our sister boards have gone down that road to do.
Well, I think the state bar might have gone a different road, but at least I understand your reasoning. You think it'd be more difficult to pass this amendment if we made it compulsory versus voluntary, right?
Yeah, my knowledge on other efforts that other boards have done would inform that when there's when you're trying to compel them to do that, there have been concerns that stakeholders have raised about that, which is why I think the successful efforts haven't gone down that route. Sorry.
Okay.
But you know, again, I think this is a proposal, and if the board were to approve it as we move forward into sunset review and working with the legislature on the language and stakeholders, there's always the possibility to make further amendments to the proposed language, and that could certainly be a proposed language if we get down the road and stakeholders say absolutely, let's require it, make sure everybody has to have one. I'm not sure that we would be opposed to that, but I'm not sure if it would be appropriate for us to come out the gate and have that as something that we want to compel you to do. Again, I think most people probably have an email address, so this is probably not a big problem. But that's the context for why we've made this a requirement only if you have it, and not a requirement that you go get one.
All right, I understand.
Okay, any other questions, concerns regarding C, proposal C?
I just had a question. Yeah. So there's no penalty affiliated if the board's informed that someone does have an email address that they haven't?
Email police.
Yeah, email police, exactly.
We didn't put this, we're not proposing to put this language under the unprofessional conduct statute. No.
This is Numberland, and I hope that this reaps benefits in more ways than one, not just informing our licensees, but also hopefully it helps the board carry out some of its duties, whether it's in regards to, maybe letting licensees know that, they're late to renew something, you know what I mean? I hope that it can benefit the board in multiple ways.
That's actually an interesting point you bring up regarding renewals, I think is what you're talking about. And right now, if you have given us an email, you are notified via email that your renewal is available. And we release renewals 97 days in advance of the expiration date. If you have not given us an email, then the only way that you're going to find out about your renewal notice is in the mail. So if you have an email address, again, we send it both in the mail and to your email address. You get that notification. So that could help. It could help in that regard. Folks getting more timely communication if they have an email on file.
Better communication.
Yeah, that's the whole point of it.
Okay. Any other concerns, questions on proposal C? Seeing none, I'll accept a motion to accept it.
I will make that motion.
Do we have a second? We have a second. At this time, I'll open up for public comment in the audience. The audience have any comments? Open up for public comment for those that are dialing in.
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you're logged in and would like to participate, click on that question mark, typically bottom right corner of your WebEx screen, and type the word comment in the text field. Make sure it goes to all panelists before clicking that send button. You can also raise your hand by clicking on the outline of a hand, which is typically bottom center of your WebEx screen. At this time, we have no request for public comment. Would you like me to close the Q&A?
Yes, please. Secretary Bragan, if you can please perform a roll call vote.
Member Dawson?
Aye.
Member Sue?
Aye.
Member Kleppa?
Aye.
Dr. Pruitt?
Abstain.
Dr. Wong?
I vote aye.
Dr. Bragg? Aye. Vice President Linden?
Aye.
President Garcia?
I vote aye.
Motion passes.
Thank you. We now move on to item 5D, that is to amend Business and Professions Code 3059 regarding encouraging optometrists to take continuing education in diversity, equity, inclusion, and belonging.
Thank you, President Garcia. This is actually a proposal that the board has already approved, but I wanted to bring it back in the context of sunset review because I felt like it's important that when we're considering our sunset report, that any specific statutory proposal that we have be adopted in the way that we're engaging right now, and then therefore they can be officially part of the sunset report. So again, this is something that we approved back in August of last year. And this is consistent with our mission and values. The board will recall back in February of this year, we adopted our amended strategic plan, which does have language specific to diversity, equity, inclusion, and belonging, and specifically has a goal that talks about evaluating and creating better consumer outcomes, such as access to care, and addressing patient needs for marginalized populations by implementation of a multi-step action plan, educating licensees about concepts of diversity, equity, inclusion, and belonging. And one of the first steps that we did on this was back in, actually before my time, in calendar year 2022, we had a presentation from Dr. Ruth Shogi from Berkeley regarding diversity, equity, and inclusion. And that kind of really set us off on this journey and having this conversation. We then came to the board with a proposal that we're going to talk about here in this item to encourage folks to do diversity, equity, inclusion, and belonging. But we also haven't waited. We haven't waited for that law to happen because we can encourage folks to take CE in these topics right now. And so earlier this year, in the spring, the board actually released such a list. We provided it in our newsletter and we sent it out on listserv, and we included it on our homepage. A list of staff research CE courses specific to these topics of DEIB. And so we're already doing that work of encouragement, but feel that it's important that we have the specific statutory language that would encourage our optometrists to do this work. This work is very important and valid as we're continuing to learn more about not just the topics of diversity, equity, inclusion, and belonging, but also as we learn more about our licensees and their racial makeup, if you will. We know, for example, that Latinos in California are about 40% of the population, but they make up less than 6% of the licensed optometrists. And so there's a lot of work that we can do about talking about these issues and engaging and collaborating with other stakeholders. So this proposed solution is quite simple. It would just add language to our existing CE statute, which is at Business and Professions Code Section 3059, to encourage optometrists to take CE in these topics. The specific language is the board shall encourage every optometrist to take a course or courses in diversity, equity, inclusion, and belonging as part of their continuing education. Again, the board approved this a little more than a year ago, wanted to bring it back and just see if we can formalize it as part of the sunset report. So happy to take questions and comments from the members on this proposal.
This is Member Linden. I just, thanks for bringing this again before the board. I think access to care is important. I think access to culturally competent care is very important. And so I think any chance we can, and this is very light language, we're just encouraging it. Maybe that'll let some people know, hey, you can also do this as part of your requirement. I hope that's helpful. And the only comment I would say is if the board is aware of courses that are out there, and those could be added, to a list or whatever it is, a list of approved courses, that might be helpful as well to encourage more people to take these courses.
So the list that we've already done is something that we don't plan on doing just once. We plan on updating it, right? Because CE courses only have a finite time of approval. They're not approved for forever. They have a 1 year, or probably maybe sometimes in some cases a 2-year approval, depending on who approved them. I think as the board knows, we don't approve all of the CE courses. A lot of CE courses are automatically approved. For example, if they're offered by an accredited institution, they're automatically legitimate and approved CE courses. But the list that we've put out, I think, includes courses that are valid until next year. I'm not sure about 2026. but it's a list that we plan on periodically refreshing and republishing to help continue to encourage folks to take these classes. So we plan on doing that on an ongoing basis. Excuse me.
Any other comments from the board?
Yeah, I agree with Member Linden. The more we know, the better we are, and that especially deals with our patients and those who we're hoping to serve. We have to be sensitive. So this helps us to be sensitive to their unique situation. I love what you said about the fact that in opticianry and ophthalmology, there is this disparage of, racial balance. We don't have it. So educating ourselves will hopefully help us to be able to educate those who are coming up. As Ms. Garcia said, we're hoping to have a lot more people come into these fields. Letting them know that they're being included would be a great way to help.
Thank you.
Good comments. Anyone else? I'll accept a motion to accept amendment B. Motion. We have a second. The motion is second. I'd like to open up for public comment for anyone in the audience.
My name is Ruby Garcia from the California State Society for Opticians. I do like this. This is great. I think we, as opticians, are not required to do CEs. We, through the colleges programs, and we will, and we do talk about this. It would be great to consider that, the people who do hiring, who are already licensed opticians, and the market managers and the regional managers, that they have that influence because they're managing us as opticians. They also be aware of diversity and inclusion, because we're noticing that it's not as strong as you've already seen there. So just trying to put something in there. I know we're going to work on it because we're not required to do the CEs, but we're still, through the colleges, are working on that diversity and inclusion. Thank you.
Thank you.
Thank you, Ruby.
Okay. And we can open it up for public comment for those that are dialing in.
This is the moderator. The Q&A is now open. The instructions will be on the screen shortly. You can access the Q&A by pressing the question mark inside of the square, typically bottom right corner of your WebEx screen. Type the word comment in the text field that appears. Make sure it goes to all panelists before clicking send. You can also raise your hand by clicking on the outline of a hand bottom center of your WebEx screen. The instructions are on the screen, and at this time, I see no request for public comment. Would you like me to close the Q&A?
Yes, please. And Secretary Brackett, we can have a roll call vote.
Member Dawson?
Aye.
Member Sig?
Aye.
Member Kleppa?
Aye.
Dr. Pruitt?
Aye.
Dr. Wong? Aye. Dr. Bragg? Aye. Vice President Linden? Aye. President Garcia?
I vote aye. Motion passed. Thank you. Now we'll move on to item 5E, which is various non-substantive technical changes.
All right. Yeah. Final item here of this agenda item number 5. The first non-technical substantive change is fairly simple, something we've talked about at this board before. Effective in August of this year, the Part 3 exam name changed. Once was called clinical skills, it's now called patient encounters and performance skills. There are 2 places in one statute that the board has identified where that name clinical skills exists, and we simply need to delete it and replace it with patient encounters and performance skills. So very simple, basic change there. Brendan, should we take a motion on this one before we move to the next one, since the next non-substantive change is on a different topic, or can we just handle them both as non-substantive?
I think we can handle them both as non-substantive.
Okay, perfect. Again, so the first one that I just mentioned is just simply replacing the name clinical skills with patient encounters and performance skills, or PEPS as it's known. The second change is a little bit more nuanced, but we still believe it's a technical non-substantive change. So right now, under Business and Professions Code Section 3151, the board is authorized to issue a retired license under the following conditions. You have to pay a fee of $25, and the license must be, quote, current and active. It is that phrase, and active, that functionally means that any licensee who is on a current inactive status is not technically eligible for the retired status because, again, they must be current and active. There is, however, no real functional difference between a current inactive and a current active when it comes to their ability to get a retired license, because a retired license is an honorific. It does not convey any ability to practice. And so we have had several instances of folks who have put their license on current and active because they're trying to evaluate what they want to do. The benefit of going current and active means that you don't have to do continuing education. So they go current and active, they don't have to do CE, and inactive status means you cannot practice, but they don't go into delinquent or any other sort of negative connotation or status on their license. So we have had several folks that are in that situation, current and active, who then come back later and say, I've made my decision, I want to go retire. And technically we have this problem where they're not active. What that would technically mean is that you have to bring your license active. Well, how do you bring your license active when you're inactive? You have to show us the CE. But in a lot of those cases, you didn't do the CE because you were thinking about retiring and now you've made your decision that you want to retire. And so that becomes a problem for these folks. We think by simply deleting the phrase and active and just simply saying current, we would allow these current and active folks to acquire this retired license. If there's any concern about somebody acquiring a retired license and then later coming back to active status, let's talk a little bit about what that looked like. There are two ways you can come back to active status from retired license. Under one pathway, you have to show CE. Under a second pathway, which exists if you have been in a retired status for more than 3 years, you have to retake part 3 of the clinical exam. So we don't feel that there's any issue with amending the law by deleting the phrase and active and therefore enabling somebody who's current inactive to acquire a retired license, because if they ever later decide that they want to not be retired and come back to active status, they will either have to show us CEs or they'll have to take part 3 of the clinical exam again. And so this change, we think, would really carry out the intent of the retired status, which was to give folks who have worked a successful long career the ability to have that honorific and not have their status be delinquent or canceled. Happy to take any questions from the members on this proposal.
Seeing none, I'll accept the motion to accept those 2 amendments.
I'll move.
I have a motion. Do
I will second it.
We have a first and a second. I'll open it up for any comments within the audience. And let's open it up for any comments from phone lines.
This is the moderator. The Q&A is now open. The instructions will be on the screen shortly. Just click on that question mark, type the word comments, send it to all panelists, or click on the outline of a hand to raise your hand. At this time, there are no requests for public comment. Would you like me to close the Q&A?
Yes, please. Secretary Brackett, we can do a roll call vote.
Member Dawson? Member Sue?
Aye.
Member Cleffa?
Aye.
Dr. Pruitt? Aye. Dr. Wong?
Aye.
Dr. Bragg? Aye. President Linden? Aye. President Garcia?
Aye.
Motion passes.
Thank you very much.
Well, you know, so now we finished item 5. Our next item is really our last substantive item, which is a sunset report. I think it's going to take a little while to go through the sunset report. It's 11:40 right now. I'm not sure if we want to take our lunch break, if we want to maybe take a quick break, bathroom bio break, and then start the sunset report, get some way through it, then take lunch. We have to take lunch at some point, is the point. So we can.
Lunch is not ready.
No, we haven't gone and picked up lunch yet. Till 12:30. Thank you for reminding me. Okay, so let me revise what my suggestion was. My suggestion would be that we take a bio break, come back, we can start the report. We'll have staff go get lunch. When lunch comes back, we'll take our lunch break and pick it back up. Does that sound? Okay. Take a 10-minute bio break.
10-minute break, and then we'll reconvene at 11:50.
Okay.
Thank you.
Wonderful.
All right, thank you. We're going to restart item number 6, update, discussion, and possible action on 2025 Sunset Review Report. Vice President Uni Linden will take the lead on this.
Thank you. Members, next we're going to discuss the draft 2025 Sunset Review Report. As chair of the Sunset Review Work Group, I wanted to provide the members with context about the Sunset process and how this report was drafted. Every board and bureau in the Department of Consumer Affairs is subject to oversight by the legislature's relevant policy committees, the Senate Committee on Business, Professions, and Economic Development, and the Assembly Committee on Business and Professions. Every few years, each board and bureau go through what is called the Sunset Review process. Called Sunset Review because the statutory authority of each board expires or sunsets on a specific date in law. For optometry, the law provides a sunset date of January 1, 2026, and if the date is not extended, the board will cease to operate. The Sunset Review process unfolds in a series of steps. First involves staff preparation of a Sunset Review report. The second step involves board approval of the Sunset Review report. The third step involves submitting the report to the legislature. The fourth step requires participation in a Sunset Review legislative hearing. The fifth step involves responding to issues raised during the Sunset Review process. The sixth step involves collaborating with the legislature and stakeholders on a Sunset Review bill that extends the board at least another 4 years. Earlier this year, the board president formed a 2-member work group, the Sunset Review Work Group, consisting of Vice President Garcia and myself.
It was then.
Oh, sorry. Yeah, then. To coordinate the board's Sunset Review process. On May 13th of this year, the work group conducted its initial meeting to plan and prepare the submission of the board's 2024 Sunset Review report. The work group met again in July, August, and September. Today, the board has an initial opportunity to review the draft report put together by staff. The board will have a final opportunity to review and approve the report at the December 2024 meeting. The report must be submitted to the legislature by January 6, 2025. The board will go before the Assembly Committee on Business and Professions and the Senate Committee on Business, Professions, and Economic Development during the spring of 2025. The board president and executive officer will both present testimony and answer questions from the members of the legislature, and the public and stakeholders will have an opportunity to provide public comment. As part of this hearing process, the committees will prepare a background paper concerning the board, its operations, and other issues. The committees will. The board will prepare a response to that paper. The hearing, the background paper, and the board's response will inform a sunset bill introduced by the committees. The sunset bill, among other things, sets the next sunset date for the board, most likely 4 years after the current sunset date, or January 1, 2030. Now I'd like to share a few comments about how the report was prepared and designed. The report was written by staff with the work group providing direction, guidance, and support. To ease accessibility for both digital and physical readers of the report, staff has used hyperlinks wherever possible and provided the website citation for the physical reader to access. There are a few highlighted areas of the report which indicates information which is forthcoming. In some cases, the data is not available, but will be prior to publication and submission of the report. For example, the recent national examination data. Also prior to publication, the report will go through an editing and design process with our DCA partners, which will help with the formatting of tables and graphics. A cover page and a table of contents will also be included. So thank you to staff for all of your hard work preparing this report for the board. I'm sure you guys have seen this is well over 100 pages, and it took the effort of everybody hours and hours and hours. So thank you very much to everyone who has put so much time working on this. So we get to enjoy the fruits of your labor. So yeah, thank you again. Now I will turn it over to Mr. Pruden, who will walk us through the report.
Thank you very much, Vice President Linden. Before we maybe jump into it, I wanted to see if members had any questions about what Vice President Linden just mentioned in terms of the overview of the process and what's expected to come and the next steps and what this is all going to look like with the legislature. So I wanted to just take a moment and see if members had any questions about that process? None. Exciting. Very good. I think in terms of our plan to go through this report, on the screen here is the report, and we're planning to scroll through it. I want to go through it section by section. I believe there are 10 sections. As Vice President Linden mentioned, there are 108 pages to this report itself. We do have lunch that is ready at 12:30, so I think a good plan would be to proceed from here until 12:30. We'll take lunch at that time and then come back and pick up wherever we were. So with that, I'm just going to jump in. Section 1 of this report is background and description of the board and the professions that we regulate. This area of the report is very consistent to how we outlined our report 4 years ago in 2020. You know, the history of the board doesn't change much, right, in terms of when we were founded and what we do, what have you. We put our mission, our values in this section as well. We talk about the composition of our board and the committees. Section 1 also provides information about what all the committees do, their function, for example, and then we have a long list of attendance. And I want to, just for the record, make note that I know that there are 2 errors presently in the attendance. Thank you to Member Kleppa for pointing them out to me. As we proceed today and we identify issues, I would like us to try to focus on more of the substance and less of, you know, formatting and things of that nature. Obviously, grammar and word choice is important, and this is your report, and so I want to hear that feedback too. But as we are going through this, as we identify items or errors, I'll be making notes, staff is making notes as well. This is a draft, and so we have obviously a master copy that we preserve, that all of these updates will be made on, and we will bring a final report for approval to the board at the December meeting. So again, I want to just walk through section 1, and I'm going to be asking the members as we go through each section whether you have feedback, comments, or edits that you would like to bring forward. So in section 1, do members have items that they would like to bring up?
I don't know if Member Kleppa, if one of the 2 things you brought up, am I supposed to be on the attendance?
Yeah.
Okay.
Not all, yeah, not all of the attendance yes. One of the issues that Member Kleppa found out was I mistakenly said we had an April 5th board meeting. We didn't have an April 5th board meeting. There was no April 5th board meeting this year. I accidentally said that Member Linden and Member Kleppa did not attend that April 5th board meeting. There was no April 5th board meeting. So attendance is still being worked on. And Member Dawson, to your point, this will change, right? Because we're having a board meeting today.
Yes.
So attendance will be noted for today. We'll have a board meeting in December. Attendance will be noted for that meeting as well. So we will make sure that we get all of the attendance sheets into the report.
And I know I'm sure somebody said it, obviously. This picks up from the last sunset report. So I read in a couple of places that things that were in the previous one weren't added to this one, or
are you talking about attendance?
No, just items. This is a continuation from the last sunset report, correct?
Yeah, it's fair to view a sunset report in that way, but it also there's new issues, right? So the sunset report exists as a connection to the prior report, for sure, right? There are issues that, as we get into further sections of the report, things that we said or information that we provided 4 years ago that now we have to update, right, and say what's going on now.
We also have to form a new strategic plan.
Not part of this at all.
No, but yeah.
Strategic planning is not part of the sunset review. That's a whole nother project. Yeah. So again, any questions or feedback? As we've noted, attendance is being worked on and ongoing. But any feedback about what we're saying about the committees, the history, the function of the board in section 1?
I could provide a fun fact. I used to work for one of the committees many years ago. I worked on one sunset review report, but yeah, basically this is just the legislature's way of, providing some oversight of what we do. All boards and groups, we are pretty unique entities, right? Kind of quasi-governmental. We do have a lot of powers to kind of oversee these professions, and so it's just a way of making sure that we're kind of doing what we're supposed to do. So every 4 years we check in, and it's just a chance to kind of share everything and keep everyone up to date. And so, yeah.
Our last one was right after COVID.
Right? Yep. Got delayed, I think, a year.
Yeah, Dr. Mordomi's.
Yep.
Yeah.
Member Sue, I know that you recently sent us a bio. Would you like your bio in the sunset report be updated to reflect that bio you recently sent us?
Yes, please.
Okay. That's on page 16 of the sunset report.
Oh, and then also on my bio, it says Assistant Clinical Professional Associate.
All right. Change assistant to associate. Let's see. Did you get a promotion?
Since the last bio.
Congratulations.
Somewhere, a couple years ago.
Congratulations. We'll make sure that we update that on the website too, because we pulled your bio straight from the website. Any?
So page 23, is that in section 1 or in section 2?
Page 23 is in section 1.
Okay, so the second part, the board participates in the following ARBO committees. We're also part of the OE tracker committee.
Okay.
I've been on that committee for a couple of years.
I will probably spell out OE as optometric education, just so folks know. Okay.
Page 33 in section 1.
33 would be in section 2.
Okay.
Member Kleppa, any questions or comments from you?
No, I think you got everything from the email and you've mentioned it in the meeting already.
Okay. Another, just since you reminded me of that, Member Kleppa, another item that Member Kleppa suggested was on page 20 under the fees regulation. And I appreciate this change, Member Kleppa. Council might appreciate it too, because if I remember right, I think you brought this up as well. We said statutory caps, and you were suggesting that we say statutory limits to be just a little bit more clear to the public. And I think that's probably a smart change. So we'll make that as well. I do want to notify the board on that same page while I have the opportunity. As we were mentioning earlier, things that are in highlight is an indication that there's an update that we're waiting for, right? And on page 20, we have the mobile optometric office program. This was just approved on Wednesday, on the 9th. So that is now going to be updated to indicate the effective date of the mobile optometric office program, which again is October 9th of 2024. So we will make that update as well on our master file. Any other questions that or comments or feedback that members have on section 1? No? Okay. Moving along.
Actually, hey, Greg.
Yes.
Why don't we do public comment at the end of each section?
Okay.
I think that makes sense.
That's a good idea.
Gives everyone a chance to.
That's a good idea.
Okay, so let's open it up for public comment from the audience for section 1. Seeing none, if we can open it up for public comment for those that are dialing in for section 1.
This is the moderator. The Q&A is now open. The instructions will be on the screen shortly. If you would like to participate, click on the question mark inside of the square, type the word comments sent to all panelists, or click on the outline of a hand. The instructions are on the screen. There are no requests for public comment. Would you like me to close the Q&A?
Yes, please. And we'll move on to the next section.
Yep. So section 2 of the report is fiscal and staff. So this is as we start to move through this report, we start to get more detailed, right? And that start being asked more questions that require, information and data. And section 2 really begins that. This is fiscal and staff. including our fund condition. These are, everything that we're talking about here in these questions is information that's come to the board before in terms of, the fact that we're operating with the structural deficit as we have been for the last few years, the vacancy rate that we've been operating under, again, as a reminder, we do not fully staff up our program because to do so would explode our structural deficit and make that problem worse. And so we are talking in here about our fund condition, our structure, fiscally, our staff, when we expect a deficit, a negative balance, if you will, and the fund condition might occur. And as we've talked about at some of our board meetings, a deficit would occur in 26-27 fiscal year if we were fully expending our appropriation. Our appropriation is about $4 million. If we were fully expending that, we would run out of money in two fiscal years. We are not fully expending our appropriation because we are not fully staffed. And so we spend a lot less than that $4 million number. We spend in the low $3 million range. And so while you see the fund condition, what the fund condition shows is if we were fully expending our budget, just like our budget documents do in our board meetings. I know that members have asked for board meetings that we could have at least two fund conditions, one that shows what we are naturally doing and then one that shows what it currently shows, which is the full expenditure of the appropriation. Here in the sunset report, they're simply asking for the fund condition, so we're only going to give them the actual fund condition. But again, as you'll see, narrative about how we are operating, how we are navigating through this period of structural deficits. And again, in terms of our staffing, we do make mention here about some of the impacts that have happened to our board, and we're not alone, obviously, regarding some of the forced cuts, whether it's vacancies or whether it's the operating expenses cut. And so we do make mention of that here to provide that information in terms of how it has impacted us. There are questions in here also about the entire fee schedule, right? Tables about the entire fee schedule. What are the fees? What are their limits? What revenue does each fee bring in across the fiscal years? And then a calculation representing what that revenue represents in terms of the total revenue. And so all of that information is located in the fiscal and staff section 2. There is also information in here about all the different budget change proposals that the board has done. A budget change proposal is something you seek when you need resources, whether it's because legislation has passed or the situation on the ground, if you will, has changed and you need to seek an increase in your resource authority. So all of that information is put here. There are also questions in this section about staff development efforts and what we do there. These are topics that we've talked about at this board in terms of, with a small staff, staff development is both very, very important, but also very challenging, right? Because you're a small board and you're limited by resources. But staff development is very important because as a small board, most opportunities for promotion are going to be outside of the board, just naturally. And so we talk in this report and in this section about how we navigate through some of those issues, some of the efforts that we make to try to solve those problems, if you will. So that is section 2, heavy on fiscal, heavy on narrative regarding staff and how we're organized. Any questions, comments, feedback from the members on section 2?
I would just have a comment, if we can.
Sure. Yep.
I was glad to see that what I was seeing in section 2 was stuff that we had talked about as a board multiple times in multiple meetings. So, I think it'll make clear to anyone reading this report that we are dealing with various financial challenges, but the board is essentially meeting them as effectively as possible, given those limitations.
Thank you for that feedback, Member Club. But yeah, I think that's exactly what we're trying to do. We're trying to be very open and clear about how, what we're experiencing, and then also what we're trying to do about that. Now, I do want to say, I think we're in a better spot now than we were, even 2 years ago. And we'll see as things move forward, how that might change, if it might change. As we've talked about as a board, we have no plans to fully expend that appropriation, because again, to do so would make our budget problem worse. In the last 2 fiscal years, we have improved our structural deficit, if you will, right? So 2 fiscal years ago, our structural deficit was around 331,000, if I remember correctly. Last fiscal year, we closed that structural deficit down to about $63,000. We're really close to almost having a balanced budget, or balanced fund, if you will, in this last fiscal year. As I have shared with the board, it only takes one case, one enforcement case as a small board, and your budget can get completely out of whack. And this board has had that happen to it in the past. And so, these things are dynamic and they change. But the other aspect to this is the fee increase has only been in effect since July 1. And so, as we've talked about with this board, we need more time to have more data to learn about how that fee increase is, what that's looking like. Is the revenue coming in as we had projected it? Is it not? Too early to say at this point. But all of that is to say that we are not talking in this sunset report about the need for fee increases right now. Certainly out into the future years, and I don't know if that's how many years that is, because again, budgets and fund conditions are dynamic. But a year ago, I think we were thinking that in the sunset report, there may be some narrative and conversation about needing more fees on top of the regulation that we just did. That picture has improved, which we're happy about, and I don't see any need, and we're not talking in the sunset report about the need to increase the fees beyond where they are right now. But again, that won't always be the case, right? As you move forward into the future years, it is likely that fee increases will happen, but I think we're able to buy ourselves some additional time with the actions that we've taken. So that's positive. Comments, questions, any other feedback from members on section 2?
I have one question. Oh, go ahead.
So member Pruitt in the room and then member Klepp online.
That's fine.
I don't have a question specifically about section 2, just to kind of backtrack into your previous question. I apologize for the delay, but I was just wondering, I get the purpose of the review but why we're meeting that requirement, but is there kind of on a external or on the global view, is there something we're hoping to achieve or gain from this report? Good positioning or certain kind of legislation? Is there some goal?
I think I would say yes to all of those questions that you just mentioned. A lot of this report is just narrative that's factual, right? And informing, as in section 2, right? Informing the legislature about where we are. As we move more into this report, you're going to see more about new issues, right? All 4 or 5 of those ledge proposals that the board just approved are all now going to be officially included in there, right? And so we are going to be working with the legislature to seek those statutory changes. So there are a variety of items in here that we are either bringing up because we need some legislative change on or want to see a legislative change on. There are also examples in here, and we'll get to them, where we're talking about the good work that we've done, right? And we want that out there, and we want folks to know about that. There are also some areas in here where we've identified some issues and challenges. And so I think it ticks all of those boxes. This is going to be a holistic process. So when we get into the spring, and the committees have issued their background paper, we will be working closely with the stakeholders, COA, CSSO, probably other stakeholders as well on the report. The legislature will identify a series of issues from their perspective, some of which we may have informed them about in this report. They also might identify issues from, certain member has maybe a unique issue in their district, for example, that could come up. And so we'll work together with the committees and the stakeholders on that process. It's not going to be something we control, but we're obviously an integral, partner in that process. So I hope that answers your question. Okay. Member Kleppa.
Just briefly, I remember in a prior meeting, you indicated that we were mandated to remove a position by the restrictions in the governor's budget or something to that effect. Do these charts show that mandated removal and what I guess would be a positive effect on our budget outlay?
So I'll take the first part. The narrative does talk about and provide the specific information about, and I'm trying to find exactly what page it is, but the narrative does in this section tell exactly that story, that the same story that's been told at the last few board meetings about the vacancy cut drill and the operating expenses cut drill. We specifically say in this report that after those vacancy cuts, for example, our org chart will have a total of 16 positions. Right now it's 17.4. But after those cuts are effectuated, which hasn't officially happened yet, so far as I know, it will drop us down to 16. The second part of your question in terms of how that might, I think you said positively impact our budget, is unknown at this point. It won't be known one way or the other for some time how our fund condition might be impacted as a result of, for example, that vacancy cut. Because the vacancy cut is done in this year, but budget planning is out into the future. So how those cuts impact and change the actual numerators and denominators in the fund condition is not yet known.
I think your paragraph is the bottom of page 31.
31. Yeah, Member Kleppa, and thank you to Member Dawson here in the room. 31, page 31, where we start talking about the staffing issues section, is the narrative where we talk about both the growth in the program's org chart. We started at 12.5 positions at the last sunset review, and then we increased to a high of 19.9. We're presently at 17.4, and we will drop down to 16 as expected soon.
Okay, thank you.
Yeah. Any other questions in the room on section 2? If not, we can take public comment in the room and then move to public comment online.
Seeing none in the room, we'll go to public comment online.
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you would like to participate, click on that question mark inside a square, type the word comment. Make sure it goes to all panelists before clicking the send button. You can also raise your hand by pressing the outline of a hand. There are no requests at this time. Would you like me to close the Q&A?
Yes, please. And we'll move on to section 3.
All right, we just start getting more detailed and a lot of data here in section 3. So section 3 is licensing program. It starts out with basic questions about what are our performance targets and how are we doing on those performance targets. We are doing very well on the performance targets for applications. In fact, all of our applications are doing very well on the application processing times. We are exceeding all of the targets. As the board knows, and we've talked about, and Member Pruitt, to your prior question about, what are some of our goals and what are we trying to accomplish and achieve in this report? This is exactly one of those areas. We know as a board that we have been challenged in the past about the timeliness of our application processing. And I think specifically on the optometry side, as the board knows, that has been a lengthy period, anywhere from 2 to 3 months. We have brought that timeline down to under a week. And so we are talking about that information in this section. And we also talk about how we did it. And so, in fact, that's the very next question, question 17, which has a very long answer, as you can see. But that is where we are exactly talking about the reforms that we made, the work that we did to bring those processing times down so significantly. We point back to the tables because in these questions in licensing section, there are a lot of tables. And I actually see a note that I'm going to make here on my side. If you go to page 35, you start to see the population tables. And again, I just make a note, some of you are likely seeing either online or if you're viewing it physically, the table has a line missing, right, on the left side of it. That's that part of the cleanup and the formatting that I was mentioning earlier. So all of those things will get taken care of. But yeah, licensing population section is a very important section because it provides the last 4 years of actual data, not just in terms of our population across all license types, but the applications, right? So if you move on to table 7, you start to see the applications received, approved, and the processing times specific for them. Specifically on page 36 in table 7A, you can see the good work that we've talked about in terms of the processing times. If you look at application processing times, you see complete apps, incomplete apps, and you see that in the last fiscal year, it took 4 days for a completed optometry application. That used to be 68, 76, 69 days. So big improvements have been made there. I'm very proud to be able to show that in the licensing section.
So I just have a question on page 33 then.
Yep.
This is the first thing for the very first item. It says minimum, median, maximum.
Mm-hmm.
The median is 30 days, but the maximum is 30 days. Did we flip that?
That probably should be 120.
120,
Yeah, it should be 120. Typo there. Good catch. That's why we're doing this. I have stared at this report so many times that I feel like I have to go back to my optometrist to get like a new prescription because my eyes are tired sometimes. But yeah, no, this is why we go through this report together. And I think, as has been mentioned, there will be a lot more proofreading checks. Council is checking this. I'm checking this. Other staff is checking it. We have partners at DCA that also will be checking it. So that's a good catch there, Member Wong. Thank you. So just moving on past the tables. So I'm now into section, page 40. We wanted to bring up specifically for the group question 20. Some of the members who have been on the board for a little while may recall that this has been an issue for the legislature in the past around out of state, out of country, specifically out of country folks. There once was a pathway, a sponsorship pathway that existed in the law. There has no longer been a sponsorship pathway since I think at least 2017, I want to say. And so it is not easy for an out of country applicant to get licensed. They might be an optometrist in Egypt. That's actually a specific case that we've heard. The law says you have to graduate from an accredited school of optometry, and the only accredited schools of optometry that apply here are in, the United States, Canada, and Puerto Rico. And so unfortunately, those folks do not have an easy pathway. There are programs that exist at other institutions, and we talked about that. There's another question in this report related to this issue. There are about half a dozen programs across the country that have pathways. Abbreviated is not the word, but like an accelerated pathway for these out-of-country folks to get education at an accredited school in the United States, Canada, Puerto Rico, and then they're eligible for licensure. And one of the 3 California schools I'm aware also has one of those pathways. Just wanted to call that out because that has been something that has come up in the past. Examinations, this section is also talking about examinations. So not just our licensing stats. I'm on page 42 of the report. Also talks about what the requirements are for examinations. And so we have that information in here. Member Pruitt, again, going back to your question about, goals, accomplishments, what are we trying to achieve here? This is an area under examinations where presently it's a 180-day wait period if you fail. It's a 6-month waiting period if you fail. And we are reporting in the Sunset Report for the first time that effective in the new year, we're going to be able to reduce that down to 3 months. And that's going to be helpful for those folks who have failed and want to retake that exam. They'll now be able to retake it much quicker than they otherwise could have. This is very important because when we talk with our schools and the students about tips and best practices for getting the license as fast as you can, which is what they all care about, the timing of when you take your law exam becomes very important because all optometry students graduate in May, and it's not hard to figure out the math from 6 months, right? And so if you waited until April to take your exam, you failed it, now it's October. And now, since we're processing people who successfully passed in 4 days, everybody else got licensed, all those job opportunities have been taken, and now you're kind of, playing catch up. So we hope that reducing this time in half is going to help applicants in that timeline. We provide information here about all of the national exams that the folks have to take, and then we provide the examination data. And I think this is going to be an area that we're going to probably be asked questions about. Because if you look at the examination data, and all of the optometrists in the room know this very well, the pass rates have been declining, and they've been declining every year almost, and significantly. And it's happening not just on our law exam, but it's happening on the national exams. So I think, when you see that, for example, on our state exam, it once was 92%, and now it's 80% in the last fiscal year. That obviously raises some questions. Similarly, with the national exam, you see almost, although we don't yet have the 23-24 numbers for the national exam, you see a similar precipitous drop, 92%, 88%, 84%, and then we'll see where the numbers are for the most recently concluded fiscal year. Important things, a couple things to share. We've done nothing to make the exam harder. From what I understand, NBEO, who does the national exams, have also done nothing to make the exam harder. So I think there's a lot of questions about why we're seeing such drops in the pass rates. I think this is going to be an area we get asked about. Board, why do you think that's happening? From what I can tell, preliminary wise, it's a lot of the retakes. The first time pass rate is much higher than the retake pass rate, which is a little interesting.
I mean, you have to think about it. The people who are retaking it failed it the first time.
Right.
So it's a different test taking population.
It's a different, yes.
Than the original.
That retake rate is in the 70% range, so it's dragging down the overall pass rate. But just wanted to mention that to the board. Again, in the exam area, this has been something that's been unique to our board. It's perhaps impacted other boards. But one part of the national exam is only offered in person in North Carolina. And this board has talked a lot about that issue in the past. And there are questions about that in this report and how we navigated through that and what that might look like for the future. And so I think that's another unique issue when it comes to examinations that maybe, again, I don't know how that impacted other healing arts boards during COVID, but it did impact optometry, at least initially. I think at the end of the day, all of the students were able to take their exams, and that was good news. But we could get asked about that, I think, from the legislature. How did that, what did that look like? What was the board's experience during that? How did you navigate? What do you think for the future, right? Because we know another pandemic or emergency or something like that will happen again.
And
Yep.
another comment.
Yep.
So just from my kind of understanding just how I'm wired and my brain works. So with this, that'd be the opportunity to, if we do and hopefully do get asked about that, could we put the spin on it? Well, it's because maybe perhaps the education of what they actually get in school, our scope is so much different from that or less than that could be part of the kind of put that spin on it.
So the way this would likely work is if the legislature identified this as an issue, it would be part of that background paper. Jeff and I would then have to testify, provide information in a hearing about whatever questions they have identified. 30 days from that hearing, written responses to all of the questions are required, and those written responses have to be approved by the board. So that's that April board meeting that we were talking about. If the legislative sunset hearings are in March, then we would go through that hearing. We would work on those questions following that hearing, and then we'd bring it to the board in April for review and approval. So it would be the board's opportunity at that time to weigh in and provide that type of language. You had a question and a comment?
Well, it's kind of question and comment.
Okay.
Would that be the time?
Yeah, that would be, yeah.
So I just want to point out on page 45,
Yep.
item number 25, the last line is talking about the MBEO exam. It says both tests are 2 hours each, and I'm assuming that's for part 1 and part 2.
Yeah.
Part 1 and part 2, the tests themselves, it's 2 sections, and the test is 8 to 5 each day.
Okay.
So I don't know, but I don't know if the NBEO says it's like a 4-hour exam, but it is a 9-hour day.
I don't even know if that sentence is necessary. It could probably just be deleted.
Okay.
But that's good feedback. We certainly don't want to say something that's not accurate there. Any other feedback or comments on this section? As we continue on page 46, we talk about school approvals. This again is talking about the accredited schools for optometry. We don't approve schools. There's not accreditation for that on the opticianry side. And so this is really just specific to optometry. And then we go into the continuing education section, which again, as this board knows, has been a big focus of the legislature, especially in the last sunset review. Again, as a reminder, there is no continuing education requirement for opticianry, so this only is applicable to optometrists. So in this section, we are not just providing the sort of factual narrative, right, about how we perform CE audits and how that works. We're also providing some data, right? And so on page 48, for example, you can see just the factual data that we did not do any CE audits in the 2 years following the last sunset report, but we've been doing them we're now in a new fiscal year, but the last 2 fiscal years we've been doing. We almost doubled the rate from year to year, so that's good. We're getting back to consistent audits. I think this is going to, again, be a question that we'll probably get asked about because it was a question we were asked about last time.
We actually got reprimanded.
We got reprimanded last time, and as a reminder for the board, maybe pursuant to that reprimand, if you will, we sought resources. We sought staffing resources specific for this issue. We brought on an enforcement manager, and we brought on an enforcement analyst dedicated to CE audits. Both of those positions started in late 2022, and that's why you see the audits being consistently performed since that time. This section also talks about the course approval process, which again is at this board occurs by the PEC, the Practice and Education Committee. And then there are also, of course, automatic providers of CE providers that are automatically approved by virtue of the fact that they're an accredited school already, for example. We also talk in here again about the fact that we updated our CE regs, right? We did that in August of 2023 to allow now for the live and interactive, among other changes. So all of that information is included in this licensing section. Questions from the members?
So also, and I were just noting that on page 47, sort of like the little asterisk that's underneath the continuing education grid. The TPA certified must complete 50 total with 35 in ocular disease and 10 in glaucoma, if also holding that certification, which also post 2008 graduate
It
students.
should say which all.
Okay.
All post. Good catch. Good catch.
I have a question.
Yes, sir.
So after the last sunset, the 2 years following, there weren't any you said that there was a reprimand. Is there going to be a further I know we have the last 2 years, we're able to say, hey, we did these, we're increasing what we're doing. Or is the legislation that petty to where they're going to say, hey, but what about these 2 years?
Yeah, but we didn't get the staffing till 2022.
I think they obviously can focus on the fact that we didn't do any in those 2 years, and that optically doesn't look good because that was the 2 years immediately following the sunset, the last sunset. But to remember Wong's point, we did have a plan, which was to seek resources, and it takes some time to work through securing a BCP and those resources. And once we got them, we immediately commenced doing.
And that was also right after
commenced doing CE audits.
Which was a hard time to hire.
How the legislature, however, is going to feel about the rate at which we're doing them, I don't know. Right? There are a lot of, we're going to have an election here in a month, and there will be a lot of new members, and so it's going to be hard to know what the makeup will be too. But there have historically been several members in the legislature who are licensees themselves, not necessarily of this board, although there have been members, at least one member recently who was a licensed optometrist. But there are other members who are physicians, dentists, or psychologists. They all have to do CE, so they're all familiar with it. And whenever they see a board not doing it and they know that their board is, it's an easy sort of thing to ask about. This specifically came up from former Senator Pan, I believe it was last 4 years ago. He's no longer in the legislature, but he was a physician and surgeon. And so that unique aspect might also have been why he was so focused on CE for optometry. But they'll identify the issues, and they'll let us know if they're happy or not happy with the rate at which we are doing them. I suspect that they will ask about the failure rate. It is still about a third. The very limited audits that we did and we identified doing in the last sunset report showed about the same failure rate. Now, that was very limited data and sporadic data. I still think that, as we've talked about with this board, the data is still limited. It's less than 5% of the renewing licensees are cautious about formulating too strong of opinions based off of that type of sample. But obviously, as we continue to do more audits, we're building more data and more of a sample. So we certainly, I certainly believe, I should say personally, that the rate of failure should be as close to zero as possible. And so I suspect that we might get asked about that. And we'll probably get asked about, well, what are you doing in terms of outreach? What are you doing in terms of education and information and all of these things? And we talk in this section a lot about what we have been doing and the fact that we've talked about this audit work at every board meeting, every board meeting since at least, I think, December of 2022. And we'll keep doing that. And we'll keep working closely with our stakeholders and other partners to make sure that licensees are aware of what they need to do. I know we're at 12:30, and I think staff went to go get lunch, but I think if we could maybe just keep going until that arrives. The next, public comment. Let's just take public comment on licensing. See if there's any public comment from members in the room. Okay.
None in the room. Let's open it up for public comment for the dial-in population. Section 3.
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you're logged in, would like to participate, click on the question mark inside of the square, type the word comments, send it to all panelists, or you can click on the outline of a hand to raise your hand. At this time, I see no request for public comment. Would you like me to close the Q&A?
Yes, please. And we'll move on to Section 4.
All right. Section 4 is the enforcement program. So just switching gears, right, from the licensing section, but very similar to the licensing section in terms of a lot of data, right, a lot of numbers. Also narrative, but again, similar to the licensing section, starts out with, what are the guidelines? What are the sort of parameters that we aim to meet, if you will. And so you see that right here. I wanted to share with the board, because I know this has been something that's come up from some of the members in the past about investigations and days and timelines. A majority of the departments, boards, and bureaus have much more generous targets when it comes to intake and investigations than this board. We are at 90 days. There are only a couple other boards that have a target date that is the same or even more aggressive than us. And those are listed in a footnote for you. Board of Psychology is 80 days, Automotive Repair is 60, Court Reporters is 60, Naturopath is 90, and Speech Language is 90. We are 90 days. Every other board and bureau at DCA has a much more time that they allow themselves for this target. There are some programs that have 270 days. There are a few programs that have a year. So we have a fairly aggressive target. And I just wanted to point that out both in this report and for the members. This is a tough target to meet for us. But I think with that context, you know, we have one of the top 5, if you will, most aggressive targets, 90 days there. We are meeting our intake target of 7 days, but we have struggled, admittedly, to meet the other targets. And you can see that on the very next page, on page 51. You can see that intake is underneath the target, but none of the other, except for probation, none of the other targets, intake and investigations or disciplinary action, our average timelines have not met those targets. I don't think that this makes us an anomaly in the department, in case you are wondering. But again, a lot of other programs have much more favorable targets that they operate under. The next question on the enforcement section is 33, and it's wanting us to interpret some of the data, right? What are the trends? What are you seeing that's happening out there? What are you doing about it, essentially? Pulled out a couple areas that we wanted to mention. This one of them, the first one, complaints, is something that we recently talked about at the board meeting. If you
Says the moderator. I believe the audio was lost. Board member Klepa, was that what you're going to say? Thank you.
Exactly, yes.
I think they are taking care of it now. Thank you.
Is it your understanding they're aware of the problem?
Yes, I believe I can't see who exactly it is, but they're working on the speaker slash microphone right now. Thank you. For the members of the public, thank you for your patience. We are resolving the technical difficulty here.
You guys should have a theme song to play whenever there are technical difficulties, like they do on TV.
We will consider that. No, I cannot hear you.
Was that addressed to me or someone in the room?
Sorry, to the room.
Okay.
Thank you. I apologize. I should be more specific here. El Dorado room, we cannot hear you. I see your video feed and I can see someone's working that
Panel?
yes.
Might be a good time for a lunch break.
Let's give it one more try.
The chat.
There we go.
Can you hear us now?
Yes.
Yes.
Okay.
Okay.
Can you hear me now?
Yes, we can hear you now.
Okay. Let's just note that, Elizabeth, you messaged me right when we lost audio, correct?
Correct. And we spoke up.
Okay. So why don't we just note for the record that the meeting paused while we fixed the technical issue, if you would just like to do that, Mr. President?
Sure. So do we have to put a time limit, time?
Around 12:43?
Yeah, that sounds about right, around 12:43.
So approximately 12:43, we did have a technical glitch where the audio did go out. We're back on the call now.
The meeting paused during that time period.
Yeah, the meeting did pause during that time period, and we're back live now.
Okay. I'm just going to keep going until either food shows up or technical difficulties happen. But hopefully not too much longer. I think food should be coming soon. I know folks are probably hungry. We were on question 33 in section 4 of the, which is the enforcement of our sunset report. And we are being asked here to talk about some trends, provide some, what are you seeing, right, in the data? What's going on? What are you doing about that? We've pulled out a few things here to talk about. One is about the complaints, which is what we were just mentioning. Complaints have been pretty consistent year to year over the time period reported in the sunset, except for the last fiscal year where we had an 85% increase, and that obviously sticks out. Why is that? What happened there? An overwhelming majority of the reason for that is because of the work that staff was doing, internally driven complaints. CE citations, for example, that's an internally driven complaint when somebody fails a CE audit. We have been doing a lot more CE audits, and so that's going to naturally increase the number of complaints. It's not solely explained by that work. It's also explained by unlicensed activity work that staff has been going after, whether that is unlicensed or unregistered optical shops, online sellers, or fictitious name permits that are delinquent or don't exist at all, but we can see that you're advertising. So that category of complaint internally generated went from 30 to 140 last fiscal year. That's the overwhelming, that makes up the overwhelming majority of the increase of 85%. However, the other category that saw a measurable, notable increase was complaints received from the public. That increased from 148 to 204 year over year. So about another 50 complaints there. I think it's a little premature to know exactly why we might have seen. I mean, that's a statistically significant increase. So why? I think, we have been doing a lot more outreach than we have been doing in the past. We have been publishing a newsletter every quarter, for example, for the last 2 years. That hadn't happened in some time. We've been much more active on social media and in other ways trying to get our information out. Perhaps that has something to do with the increase in complaints there. But that's a trend that we saw, right? The data shows that as a trend. Consistent complaints, boom, massive increase. Why? These are the reasons why. Citations issued, right? As we just talked about, there were no CE citations issued. There were also no citations at all issued in fiscal year 2020-21. Now, that was COVID year, at least partially. Not a single citation issued during that year. We issued 61 citations last year. Now, not all of that is CE. Some of that is other administrative violations, but that's a trend. We went from no citations issued to 61. Investigation closure times. We did make improvements in this area. In 2020-21, we averaged 329 days on the optometry side and 458 days on the opticianry side. And the last fiscal year reported, those timelines have been brought down to 122 days and 236. So that's an improvement that we're happy about. The next several pages show all of the enforcement data. Both complaints, investigations, the citations, the discipline actions, petitions. So when you have discipline imposed and you're on probation, you can petition for that probation to be terminated. All of that is shown here in this section. The last table on page 55 is table 10, which is the enforcement aging, which shows the percentage of both investigations and then attorney general cases that were closed within specific time frames. There are a series of questions. I'm now moving ahead a little bit to the citation and fine. Just going back to what Member Pruitt had brought up before about, goals, what are we hoping to, achieve? Remember, we have two programs, optometry and opticianry, and they don't always look the same or operate the same. And in the citation and fine world, that's a great example. The citation and fine programs for the two programs are essentially completely different and distinct. Under the optometry program, we have what we refer to as a class system, Class A, Class B, Class C. And a Class A citation has some specific language and requirements associated to it compared to a Class A. None of that exists on the opticianry side. In the opticianry side, the regulations point to specific code sections in the law, which is very problematic because code sections change. And as code sections change, you have to always update your regs. And if you don't update your regs, you can now have a situation where somebody has committed a violation that you can cite them for, but not fine them for. And that actually has happened a few times on the opticianry side of things. Another example here is, much like optometry has an unprofessional conduct statute, so does opticianry. Under the laws right now, because of the way that code sections have changed, an optician who is found, who has violated the unprofessional conduct statute can never be fined for it. They can be cited for it, but they can't be fined because the regulation points to a code section that doesn't exist because the code sections got changed. So we need to deal with this problem by updating our regs, and we want to make them as consistent as we can across the two programs. The other reason why we want to make them consistent is because the same staff issuing citations and working those cases is working those cases. And so they have to have templates for optometry and templates for opticianry, and that can lead to mistakes, and we don't want to have mistakes. So here on page 60, we are talking about that fact that the citation programs look different across the two programs. It's also different in the appeal rights, which I think is another sort of important thing to talk about, and it's something that's there's not equity across the two programs. So if you're an optometrist and you want to contest a citation, you have 30 days to do that. If you're an optician, you only have 10. I think we would want to move forward to syncing that up, and we would want to sync it up, not by dropping optometrists down to 10. We would probably want to make opticians have the same 30 days that an optometrist has. From there, when an optometrist wants to schedule their conference, they have 60 days. An optician has 30. So we want to make those consistent across the two programs. This would be a regulatory change, not a statutory change, but we're talking about that issue in this section. And again, these next several pages just go on to provide questions and data about citations and fines, cost recovery, et cetera. We're almost at 1 o'clock. I want to be respectful of lunch. Do members have any questions or comments on this section that we should address? Any edits or feedback?
I have a comment.
Yes, sir.
It has to do with the targets for enforcement, something I know we've talked about in prior meetings. And while you have indicated, I'm sure fairly, that our targets are somewhat aggressive, I think it's to the board's credit that we are attempting and have staff attempting to meet those aggressive targets, because as they say, justice delayed is justice denied, and we want to be sure that enforcement is on top of issues as much as it can be. And I think that's something that's worthwhile pointing out to the legislature, that we are recognizing that need and aggressively moving to meet that requirement. So I think it's to our benefit and credit that we have these targets, and I'm glad that we are attempting to meet them and moving forward in meeting them.
Yep, I appreciate that, Member Klumpa. And to be clear, I'm not at all bringing up the fact that we are different than the majority of the department in hopes of changing our number and making it more favorable to staff simply so that we can meet it. I agree with you. It's important that we have something to go after, right? And then a more aggressive target serves that purpose. I simply wanted just to provide the context, not just for the board, but for members of the public and the legislature that, you know, it was actually news to me. I didn't even realize that we all had different targets. So I just think it's important that that be out there. As you can see on the next page, 51, you know, we had a little bit of trouble in intake and investigations. It did go up, but it has started to come back down, and we hope that we can continue to improve on going from 328 days to 195 and hopefully make further improvements from there.
And that was my only point. When you are defending this in front of the legislature, you are pointing out to them through the existence of the targets, a recognition of an issue and active attempts to meet those requirements and therefore better the actions of the staff. And I think that's all to the credit of the board and its staff.
Thank you.
Any other board comments on section 5?
Section 4.
Section 4?
Yes.
4. Any public comment in the room on section 4? If we can open up for public comment for section 4.
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you would like to participate, click on that question mark inside of the square, type the word comment, send it to all panelists, or press on the outline of a hand. No request for public comment. Would you like me to close the Q&A?
Yes, please. At this point, we'll go ahead and take a 30-minute.
I think we have to take longer than 30.
How long?
Moderator, can you help us out with the lunch question? Is it possible to take a 30 or do we have to take longer than 30?
That would be up to all of you.
Okay.
Some boards do work straight through lunch.
I don't think we can do that because we have public employees and they have to take break.
That's good. I don't know.
Is it at least 30? At least 30. Okay. Thank you, Melissa.
So we'll take a 30-minute lunch break until 1:30.
1:30. 32 minutes.
32, I was about to say, it's 32, so it is more than 30.
We will return at 1:30.
Yes, I can hear you. And we would just need to turn on the camera again.
Oh, we got to start that video. I see what you're saying. Yeah.
Yes. Yes, start the video, please. Thank you.
Never mind.
There you go.
All right, we are ready, I believe. Oh, sorry, we got to wait for our quorum to be established again. Should we reestablish it since we came back from break?
Might as well.
Okay.
Doesn't hurt.
All right, we will be back shortly.
Okay, we're back at 1:30. We have a quorum present. We're going to continue on with section 5, public information policies.
Thank you, President Garcia and members. As was just stated, we are on section 5, public information policy. This is a short section of the report, just asking us, how do we keep folks up to date about what we're doing? I think as the members know, we primarily achieve that by listserv and social media and what we're doing today, right? All of our board meetings and committee meetings are publicly accessible. They're noticed. We webcast every meeting, not without challenges sometimes, but we do webcast every meeting. We post them on our website. They are also, the meetings are also available on, DCA has a YouTube page. We establish an annual meeting calendar, right, as we just did. So that's what section 5 is about. It's a very short section. Any comments, questions, feedback from members on on section 5.
I have a couple comments.
Sure.
Okay, looking at section 51, it does talk about various modes of communication by the board. It doesn't mention email. And since you indicated earlier in today's meeting that you send notifications of renewals by email, it's actually received faster by email, I thought it'd be good to add that.
Yeah, that is great feedback, Member Kluppa. Well, listserv, yeah, Member Kluppa is talking about something different though. Listserv is when you have gone to our website and filled out the form that you want to be on our listserv, on our email list. I believe what Member Kluppa was talking about is for those folks who have provided us an email address as part of their application, when your renewal comes open, your renewal notification goes also via email since we have it, but also address or record. I think that's what you were referring to, Member Kluppa?
Exactly.
Yep. Yeah, that is a good addition. And there's also probably a way now that the board has approved that email ledge proposal that I could probably weave in some narrative to this question about how with that change, with that proposal, if we were able to capture those email addresses, we might be able to do more right there in terms of getting information out. That's a good comment there. Thank you.
I would also
Any
mention.
other comment?
Oh,
go ahead.
Sorry.
Go ahead.
Yeah, just also in both 51 and 56, it's phrased as primarily communicates or primary methods. I don't know if we necessarily need that word because the board is communicating through all these methods equally, I assume, and doesn't focus on one more than others.
Yeah, that's fair. I think that's just an extra word that doesn't really add much. We can delete primary from 56 and primarily from 51.
Yep, that's all I had.
Any other comments from the board on section 5? Seeing none, any public comment from anyone in the audience? Let's open public comment for those that are dialing in. Section 5.
This is the moderator. The Q&A is now open. The instructions will be on the screen shortly. They are on your screen. If you would like to participate, click on that question mark, type the word comments, send it to all panelists, or simply click on the outline of a hand. At this time, there are no requests. Would you like me to close the Q&A?
Yes, please. And we'll move on to section 6.
Very good. Section 6 is online practice issues. And there is only one question in this section. This question has to do with online practice, any issues that we're seeing with unlicensed activity, and how we navigate that. How do we deal with those issues? Importantly, and we start out the answer of this question by providing the information about since 2022, we are now regulating non-resident, meaning those folks that are not located in California, essentially online sellers of both contact and spectacle lenses. Prior to that time, if I remember this correctly, it was only spectacles that were governed in this out-of-state category. And in 2022, we got the Non-Resident Ophthalmic Lens Dispensers Registration Act, which brought in contact lenses as well. So all out-of-state sellers that ship furnished mail to a consumer in California, ophthalmic lenses with a prescription are required to be licensed or registered, I should say, under our board. These are, again, web stores. These are internet businesses, not with physical locations in California. We also regulate aspects of advertising, as we have talked about earlier today. But the bulk of this question answer here is talking about the fact that we are aware that there are retail spaces out there that are not registered, and that these retail spaces are places where folks, consumers, can walk into and walk out of with a product that's a prescription. They essentially receive an eye exam. From the consumer perspective, they have received an eye exam. The problem is that, and we have indicated in this question here, from the consumer angle, they're not clear about who's providing them that exam. Under the law, unlicensed folks can do a lot of things pursuant to the direct responsibility and supervision of a licensed optometrist or ophthalmologist. But according to at least one retailer's website, and we have their information, that information here in this question, the consumer walks into this place and gets a series of tests that are performed by an unlicensed person, and it's unclear whether they ever see an optometrist, whether they ever see an ophthalmologist. It's not exactly clear whether there's a licensee on site even. We talk more about this issue when we get into later sections in prior issues, excuse me, numbers 12 and 13. So we'll talk more about that there. We also talk more about it in current issue number 2. But the issue that we're trying to bring forward here is that it doesn't appear clear from our perspective that consumers are aware that the business that they have walked into is not registered or regulated by the Board of Optometry at all. And so that's what we're talking about here in terms of online practice, unlicensed activity, pursuant to Section 6. Any questions? I suspect there probably are. And I think as we get into prior issue number 12 and 13 and new issue 2, some of this will maybe make more sense and we might have more conversation at that point. But if there's questions about what we're talking about here right now in terms of online practice and this unregistered activity, happy to answer those questions now. Any questions from the board?
Curiosity. So the site or whoever says that they claim that they're working with an ophthalmologist, does the medical board have anything that they're trying to do about that at all that you're aware of?
Not that I'm aware of.
I actually went through LinkedIn.
You did?
Yeah.
Oh.
So, so they have a remote refractionist, and you're not informed that they're a technician. They wear a white coat, put you through the refraction, and then a few minutes later, ophthalmologist signs off on the prescription. You never even talk to a doctor. And actually, on the waiver that you sign through the whole thing, you're not even guaranteed a diagnosis, which was interesting. That's part of the,
Right, how did they initiate the telehealth?
The local technician will queue up the refractionist, so they'll run you through the, well, they'll have a lensometer for a previous prescription, autorefractor, and CT. They do an anterior segment photo and a posterior segment photos. And actually, the listing is a little different. I don't know if they've changed it, but it was worded where it seemed like you would get a slit lamp examination, and that's, you don't.
That's your anterior seg picture.
The anterior seg, but when the list of tests, they did mention it. I don't know if it's been changed, but it has the exam.
Consumer probably doesn't know what slit lamp is.
No.
Right?
No.
No, but on their website they had it listed, so you were thinking you'd get it.
So you actually, but you see the ophthalmologist on screen?
No. So you only see the refractionist, and it's sent off electronically, and then it comes back with an ophthalmologist signature on the prescription. It's located in Texas, but has a California license.
How does the refractionist introduce themselves?
They don't. Basically.
They say hello, right?
On the screen, and
It's interesting because under the law, only a licensed person can initiate telehealth.
Oh.
No unlicensed person can. And there has to be consent given. You have to be known, you have to know as the consumer that that's what's happening. It doesn't sound like that's what's happening in that situation. And that's not a license.
Very, very fine print that.
Yeah. Interesting.
After COVID, telehealth just took off.
Yep.
Were scared of contact, and they introduced themselves as a way to have an exam with the least amount of contact. Bought into it.
Even if you consented to someone initiating the telehealth, that person, regardless, still has to be licensed to initiate.
Well, maybe the text just says, question or something, and then the person who initiates the call would be the ophthalmologist, the remote person. They would start the call, and that's probably a way you could get around it. But
not yet, but we will.
Any other comment on section before we open it up?
I'll just go back to the telehealth statement I was making. I mean, this is the Business Professions Code 2290.5. Before the delivery of healthcare via telehealth, the healthcare provider initiating the use of telehealth shall inform the patient about the use of telehealth and obtain verbal or written consent from the patient for the use of telehealth. And the consent shall be documented. And again, only a healthcare provider is defined under this law, and it's only a licensed person. So that's an interesting scenario.
Registration tablet does have the disclaimer about the health and
Interesting.
So we'll take the public comment from the audience.
I just wanted to.
Ruby, come up to the, gotta be formal, right? State your name, affiliation. Yeah.
Well, I'm Ruby, California Society for Opticians. I'm just curious, do we all understand that in different states, for opticians or technicians, there's no licensing required? So I'm sure you said it was the state of Texas, if that's where that technician was at.
I have no idea where the refractionist was located for the ophthalmologist.
So it's written that it has to only be for licensed person. It's just not required for opticians to be licensed. There's no licensing board. They don't.
You're talking about other states, though.
Yeah. Other
yeah.
states.
So this statute wouldn't apply to other states. Yeah.
Just here.
Yeah.
Any other comments from the audience? Seeing none, we'll go ahead and open up the public comment for dial-ins.
This is the moderator. The Q&A is open. The instructions are on the screen for your reference. If you would like to participate, click on that question mark, type the word comment, send it to all panelists, or simply click on the outline of a hand. There are no requests for public comment. Would you like me to close the Q&A?
Yes, please.
Okay, we will move on to section 7, which is workforce development and job creation. Only a couple questions in this section, but there's some unique information that we're putting out here. So I want to kind of walk us through it a little bit. The first question here has to do exactly with what the title suggests, workforce development. What do we do as a board to help our workforce develop? And we've been thoughtful, I think, about this question and tried to put information down that really gets to the question. So some of the things that we've done to workforce, make sure that the workforce is developing is by making improvements to get them timely licensed. I think that's a key one. And we've talked a little bit about the work that we've already done there and bringing that timeline down to under a week. But that's not enough, right? Simply just get people licensed. That's a very important first step, but what are we doing beyond that? Well, we've already handled, again, at this meeting today, the DEIB ledge proposal and the work that we've done there. I think that's an important piece of evidence, if you will, about the proactive work that this board is doing to ensure that the workforce is professionally developing. We've also been bringing presentations to the board, right? We recently brought a presentation from Dr. Barnett from UC Davis regarding hormones and ocular issues, very innovative and kind of interesting emerging topic. And there are more opportunities, I think, like that are out there that this board should pursue. And so that's what we're talking about in this question is we do have a role to play here. We've been doing some things in that area, but we think that there's probably more that we can do as well. We have a question here about assessment of license delays. And I think, again, we've talked about this one and the improvements that we've made there. The outreach that we do with schools. I think as this board knows, I and staff have provided presentations to all of the California schools. We also seek additional opportunities to conduct this work with the opticianry side, because it's not just our optometry schools. We know that there are more and more and exciting programs coming online in the opticianry world. and we constantly seek opportunities there. Just yesterday, for example, myself and staff visited the Sacramento City optical training program, and I know at least a few members have interest in touring facilities like that, and I'm happy to report now that what we saw yesterday looked amazing, and very much looking forward to bringing the board to that location, the Sacramento City College Optical Training Program. So those are just a few other examples of what we're doing, right, to get outreach and information out to the students. The next question is kind of a big one. Describe any barriers to licensure and or employment that the board believes exist. And when it comes to optometry, the fact is that in California, the law does not authorize optometrists to practice to the full extent of their training and education. 20 other states have a scope that is more expansive than what we have in a variety of ways. Some of those states incorporate the use of lasers. Some of those states allow for more surgical procedures like removal of lumps and bumps and things of that nature. California law does not authorize the use of lasers, and there are, again, other examples where our scope is not as advanced as other states. I think perhaps related to that, and the reimbursement rates under our social assistance programs have been low compared to some of our neighboring states, and we know that thanks to the legislature and the administration, that's expected to change in the outgoing years, and I think everybody's probably very excited about that. But these might be some barriers to entry to the profession in California. I think economic forces are probably another factor. Optometrists graduate with high debt loads compared to other healing arts providers, and the California economy has, had some troubles over the last few years. All of this is to say that what we are showing in this question is a 10-year trend line chart that shows our initial applications negative trend line. So we're not seeing a lot of growth in the optometry profession. And all the reasons that I just mentioned are possible explanatory variables as to why that might be. There's probably other factors that we aren't aware of as well. That leads into a 10-year chart that shows also a negative trend line, a less severe, if you will, negative trend line for our renewals. And this matters because historically, the biggest percentage of our revenue came from optometry renewal. And over time, that's been dropping. And it's been dropping because we're seeing either very slow growth or no growth on the optometry side of our house, if you will. So we're putting this data out here, this 10-year chart to try to paint this picture. 10 years cuts across a lot of different economic cycles. It cuts across COVID and other challenges, and really paints, I think, the picture of what we're seeing. The next question, 62, goes into workforce development data and questions of that nature. And I've shared with this board at prior meetings, when we've talked about on your renewal application, there are a series of questions that are demographic data questions. They're optional to answer. We collect that data and we supply it to the Department of Healthcare Access and Innovation. And earlier this year in 24, they put out their first report using a lot of this data. And so we pulled out the optometry specific data from that report and put it in this sunset report. This is data about retirement estimates, the age distribution of our licensees, the racial distribution, languages spoken, geographic representation, and a distribution index. A distribution index is the magnitude of the difference between a region's share of providers and its share of the population. So an index of 1 would suggest there's parity, for example. So excited to put this data out there. I think it's important that the public and stakeholders in the legislature know about it. One thing I wanted to point out that's very positive, according to this report, the language is spoken. I was surprised and happy to learn that of all of the health providers in the report from earlier this year, optometrists have the highest rate of multilingualism, which I think is something to celebrate and something to be proud of. If you look at the distribution index, you can see that, Central Valley needs some help. And I think a lot of us all are aware of access to care issues that exist in not just that region of the state, but in other regions of the state. The Central Valley is at 0.55 and needs some, more providers, essentially, is what we need in that area. But this is exciting data to have. Until earlier this year, this data hadn't been published and presented in the way that HCI is doing now. Unfortunately, we only have this data for optometrists at the moment. It's collected for opticians, but HCI has not yet published that data. We have asked them about that, and we're hopeful that they will publish that in the future. There's also a question about successful training programs, and we don't measure the programs in that way, right? Success, or we don't track measurements about the success of programs. But we are aware, especially on the optometry side, that there are, for example, there's a program called the Summer Health Professions Education Program, which exists to help get undergraduate students that have interest in optometry sort of in a pipeline, if you will, to pursue that, to pursue that information. There's also a question in here about what we're doing to reduce or eliminate inequities that are experienced by licensees or applicants from vulnerable communities, and also what we're doing to help protect people, consumers that might be in a marginalized or vulnerable population. Again, I think one of the main inequities was the fact that it took forever to get licensed. And we've brought that down, as we've talked about several times today. But we put 8 other specific initiatives that we have undertaken, if you will, to help address this question of inequities and vulnerable populations. You can find this list on page 71 and 72. So that is section 7. Happy to take questions or comments from the members.
Definitely a lot of good stuff.
Thank you. Thank you.
Very proactive. Any comments from the board? And any comments from anyone in the audience on section 5? 7. Okay, let's open up the public comment for section 7.
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you would like to participate, click on that question mark, type the word comment, and send it to all panelists, or simply click on the outline of a hand. At this time, there are no requests for public comment. Would you like me to close the Q&A?
Yes, please. We'll move on to section 8.
Well, this one might be the easiest one. I'm just going to ask, does anybody have questions about section 8? This has to do with Breeze. And as you can see here, we are using Breeze. There are no plans to change off that system. So if there's no comments or questions from the members on section 8, go to public comment.
Public comment? Yes, no? Okay, let's open up public comments for section 8 online.
This is the moderator. The Q&A is open. Instructions are on the screen. Click that question mark, type comments, send it to all panelists, or click on the outline of a hand. No requests. Would you like me to close the Q&A?
Yes, please. We'll move on.
All right. Section 9. So section 9 is board action in response to prior sunset issues. So I want to try to clearly explain what you're seeing here. When you start here on page 73, administrative issues, issue 1, that was issue 1 identified by the legislature last sunset review. Okay. Then we have their staff recommendation. That was the legislature's recommendation from last sunset review. And then we have our response to that. That was the response, again, being legislature identified the issues. We had the hearing, 30 days. We had to provide written responses, board approval. That was our response, board approved response from 2021. The current response is current response, right? We're being asked to provide a current response to that prior issue. So that's the way this entire section flows. Current response is in blue text. First question is just about our vacancies. It's just factual. We have 2 at the moment. The second question has to do with the RDO member. We only have 1 optician member on the board. It has been filled fairly routinely. However, the tenure of that person has not been very long. I think the 2 prior folks before member Dawson were about 1 year each. And so, you know, again, we also are wanting to be clear here. We're a little unique. We're the only board in the country that regulates opticianry with optometry under one program. So it's important under that structure that the optician member be filled and have that voice. This goes right into the next question, which has to do with our dispensing optician committee. And I think, as this board knows, that's a committee that has not met, and it has not met because it has no ability to establish a quorum because we don't have enough appointed members. We look forward to working with the legislature on that. I think as we get into sunset review, there will be probably some conversations about the DOC and how it's operating and what that might look like. It's a 5-member committee, and we would need 3 more members appointed to that committee to be able to have a quorum and meet and make decisions. You know, we haven't had a conversation at the board level about what we think or how we feel about the DOC and whether it should continue as it is or whether it should not. It has not met for several years. And so I think this will be something that'll come up during sunset review as probably an issue that we're asked to respond to as a current issue, because again, the committee hasn't met and doesn't have members appointed to it. Board attorney, this was an issue last sunset review for us. I think there was some thought about maybe whether optometry board needed its own attorney as an employee of the board. And so just as a reminder, or perhaps you did not know this, Brendan does not work directly for the board. Counsel does not work directly for the board. He's not an employee of the board like I am, right? Or like other staff is. He's an employee of the Department of Consumer Affairs that's assigned to our board. That's how almost every board in DCA works, I believe, with maybe the exception of medical board, which does have its own attorney on staff. I am very happy, and I hope this board is very happy with not just the services of our counsel that's present, but that all of the counsels that I have worked with during my time have been very professional, accessible, helpful, and I'm very grateful personally in my role as EO that we have that access. You know, Brendan counsel is always available, reg counsel is always available, supervising attorneys are always available. I think this board, we've been happy over the last couple of years with our council representation, but that may not have been the case always in the past.
We had a high turnover.
We've still had a high turnover. I mean, since the, I think last sunset review, we've had 6 attorneys assigned to us. So that is a lot of turnover. That's just factual. But we I think are satisfied with those services. I am, at least. Fund condition is the next question. There's a simple question about when the funds were going to be merged. They were merged last fiscal year, so now we just have one fund. We talked about this a little bit at the last board meeting. The next question had to do with Attorney General rates, the rate that we pay the Attorney General for the services that they provide. The context of this question was a couple years back. AG rates increased quite significantly, and they increased quite significantly with not a lot of heads up, if you will, to the boards. Their rate recently increased again a couple months ago, not too severely this time. Similarly, we really didn't get any notice, or at least not a lot of timely notice, and so it's hard to, budget plan sometimes. This is an area of our fund condition, as we've talked about, that we don't have that much control over. We certainly don't control the rate at which they need to be paid, so it can have impacts. Now, this rate increase was fairly small. I don't anticipate that we would have any measurable impact, but it's an increase nevertheless. Next prior issue had to do with, again, AB 2138 and the Fair Chance Licensing Act, wanting to know, what we're doing in terms of implementing that. That was the issue 3-4 years ago. Our update this time is, as we've shared with the board last year, we produced an FAQ on this topic to try to be even more helpful to applicants and licensees. And that's published on our website and linked within this answer as well.
The
legislature was interested. Go for it.
Question. Do you want us to comment on these issues after we get to the end, or do you want to do it as we go along?
Oh, if you got comments, we can do it as you go along.
Okay. I did have a couple questions on a couple issues.
Sure.
The first one, let me look at it again here. Go back a little bit. Give me a moment. Oh, sure. Yes. On issue 4, board council. Do we have any kind of a commitment from DCA that our current council will be with us for any particular period of time, or are we likely to have more turnover in the near future?
Well, no such commitment, I think, would be possible to give. I have no expectation that Brendan is going anywhere.
Anything.
He hasn't said. He hasn't. I mean, it's a hard question to answer, Member Klubba, right? I mean, if you're asking whether we think that DCA will reassign a different attorney, I don't think that that's going to happen. But I don't, Brendan has to make his own decisions about where he wants to work and not work. So he could, of course, decide, I don't like DCA and I want to go do something else, and then we would have to get a new attorney. But I have not experienced a counsel being assigned and then having a change absent that counsel departing the department. It's certainly possible. I work very well with Brendan and love working with him and hope he stays with us for quite a while.
Okay, that was really my question as to why we had so much turnover. If it's because attorneys have left state service and gone on to other opportunities, perfectly understandable. I just wanted to be sure we weren't having them shuffled at random by DCA for its own purposes, and that doesn't sound like it's the case.
No, they'd hear from me if they were doing that. Okay. The attorney prior to Brendan left the department. The attorney prior to that went on maternity leave. So there's some things that happen.
Fair enough. Okay. I just wanted to bring that up. And then on the one we just finished, let me find that again. Yeah, it's under issue 6, Attorney General billing rate. In the current response, down towards the end of that response, it says, second line from the bottom, the line begins into its own budgetary calculations, and then it says, the increase alone is not expected to lead to any fee increase or increases. I'm not quite sure what that sentence means, because you're referencing increase 1 and then it's not going to lead to increase 2. So that may need to be clarified.
Okay.
You see where I'm referencing?
Yes, sir.
Okay, fair enough. That was my only other issue.
Yep. Okay, thank you. So I think had just finished 7, which was the FAQ that we did for Fair Chance Licensing Act. And the next one was issue 8, which was whether we should merge the 2 practice acts together. And I don't think that would be a good idea. That's admittedly something this board hasn't discussed as an agenda item, but the practices of optometry and opticianry are distinct and different, and it would not make sense, in my estimation, to combine the two at all. So that's what we say there. Issue 9 is something we talked about a little bit earlier about foreign graduates. As we mentioned earlier, there is no direct pathway for them. They have to go to an accredited school first and get a degree. There are a handful of programs, and we've listed them, that we are aware of that have these accelerated pathways that exist. The alternative for this would be for a law change, and we would be basically going back to where we were, which was sponsorship. So we provide that information. The next one has to do with, issue 10 has to do with the NBEO exam and having to do with the fact that there was a single testing site and COVID and the pandemic and the travel issues of taking that exam. NBO is not going to open a second location anytime soon because of costs and other considerations. They did do a study analyzing that, but are not going to establish a secondary location. As we
had also looked at another location would be more central.
Oh, central.
And they're not going to do that.
You know, ultimately, all of those candidates during the COVID time were able to take their Part 3 exam and get licensed. So I think the worry that existed initially turned out to not be something that was as worrisome as it really needed to be, maybe. But I think this does present the question about what happens during the next pandemic or the next emergency or national event of some sort.
And there's also the hardship of West Coast people having to travel to the East Coast.
Yep. Yep.
The cost of that on top of everything else.
Yep. Hurricanes, everything.
And what if the center gets taken out by hurricane, tornado?
Yep. Yep. Issue 11 is the next one, having to do with CE. Again, we've talked about this one a lot. This is a very similar response to what we've mentioned elsewhere in the report. Again, about the program itself, what we're doing, and the number of audits that we've done, and what those rates are looking like. Questions 12 and 13 and even 16 start to become related to each other and start to get a little bit, there's a lot of detail here. So in question 12, we're talking about telehealth, teleoptometry, emerging technologies, remote eye exams. The staff recommendation from 4 years ago was to inform the committee whether we've seen any adverse patient impacts from these technologies and platforms. We provided our response that had to do kind of twofold response. One part of it was what we're seeing on the optometry, ophthalmology side with the unlicensed assistants. The other side of this is on the opticianry side, and the technologies that are being used there. One of the changes that came out of our last sunset in that area was, again, the registration of the non-resident ophthalmic lens dispensers. So folks that are selling prescription contacts or spectacles into California have to be licensed and registered. Part of the issue here that we're bringing forward is the definition under 2544 of the Business and Professions Code, which speaks to an unlicensed person being able to provide certain services under the direct responsibility and supervision, that there is no definition of direct responsibility and supervision. It's not exactly clear what that means. Does that require somebody to be physically present? Does that require somebody to provide supervision in some sort of real-time sense if they're not physically present, for example, through a remote technology? It's not exactly clear what that means. In other areas of our law, for example, on the opticianry side, and a registered optician can supervise an unlicensed person, but they must be physically present. Another related law that requires physical presence for unlicensed, well, I shouldn't say unlicensed activity because it's technically not unlicensed activity, but pursuant to COVID, when COVID hit, a law was introduced, SB 509, which authorized temporary licensure for optometry graduates who had not yet taken the Part 3 because of the COVID pandemic. And they could have gotten a temporary license to practice OD under certain terms and conditions, but most importantly, if they were being supervised physically by a licensed optometrist. And so there seems to be a little bit of a disconnect in some of our laws where certain providers have to be physically present to do supervising activities. And then we have this whole other section of law that doesn't require it. We have more that we say about this in the next issue in 13, as well as in 16, and then as well as a new issue 2. So that's basically what we're saying here in issue 12. Again, issues around what does direct responsibility and supervision mean? It's a little unclear what that requires. Any questions about that so far before I move into 13, which is related? Okay. 13 is, again, having to do with RDOs. How are we enforcing those laws? Our response last time talked about a series of citations that we had issued against a entity, and then some of the challenges and issues that resulted from that. In our current response, we are mentioning again this direct responsibility and supervision issue that we just mentioned, but also trying to put a little more color behind how we understand these entities are operating. And it appears that these entities are operating by establishing some sort of landlord-tenant relationship with somebody else, in this case an ophthalmologist, it appears, where that ophthalmologist or their corporation might be subleasing some space from this entity. It is within this sublease space that it is claimed that all of the licensed activities are occurring. As mentioned in the prior response to issue 12, we don't know what direct responsibility and supervision means. And so it's not clear to us if consumers even know that when they walk into one of these establishments that they are being seen by somebody that's not licensed. It's also not clear whether this consumer ever even sees somebody that is licensed at all. So this is related both to the direct responsibility and supervision issue, but it's also not exactly clear what these entities are. Under Business and Professions Code Section 655, we have a definition of an optical company, which says that is an optical company is a person or entity engaged in the manufacture, sale, or distribution to physicians and surgeons, optometrists, health plans, or opticians of ophthalmic products. They're not selling to the public, right? They're providing them to the licensee. We have other areas of law that define what a registered dispensing ophthalmic business is, and that is a business that advertises optical services to the public. It appears that that's what these companies are doing, but it's unclear how exactly they are operating and whether the law as intended actually captures them in the regulation or not. So that's what issue 12 and issue 13 are talking about. I will move on to issue 14. Issue 14 has to do with whether RDOs should be treated more like trained professionals in their in the enforcement and licensing activities. You see our prior response indicated some of the work that the DOC was going to be doing. As we know, the DOC has not met for some time, so the DOC has not been able to engage in some of these questions specifically. But what we did do as a board since the last sunset report was we did complete a few occupational analyses and scope of practice studies, and we provide what the results of those studies were. At that time, in those studies, no changes to the optician professions were recommended. We also received a study as a board last year related to unlicensed optometric assistants, and the board took no action on that study. So I think there's more outreach that this board and staff needs to do with these institutions, with these schools, to help inform this question, right? And whether opticianry should be more professionalized, if you will, in the way that optometry is. And what do we mean by that? Well, right now there's no state law exam requirement for opticianry. There's no continuing education requirement for opticianry. Those are two examples that don't exist on the opticianry side that do exist on the optometry side. There is no degree requirement to be an optician in California. You simply have to pass one of the national exams. There are, however, a handful of programs, and very excited because it seems like more and more are coming online in this educational space to provide education to train the future opticianry workforce. At least one is a degree granting program. The rest are certificate programs, but I think some of the certificate programs do have interest in the future and possibly being a degree granting program. So we're not recommending any changes at the moment regarding this issue and in this question. I think we need to do more outreach and education and continue to dialogue with our stakeholders on that side.
I just make a comment?
Yes, of course you can.
It does seem like this issue kind of ties into the whole direct or indirect supervision thing either, because I think part of the idea of having unlicensed people do these activities is that, okay, they're still kind of under someone's supervision, but if that supervision is someone remote in another state that may or may not, you know, really be paying attention to what's going on, you know, I kind of feel like they kind of go together.
Mm-hmm. Yeah, good comment. Mm-hmm. The next question is 15, and it has to do with independent contractors in this court case from a few years ago, known as Dynamex. This does not impact our board. It doesn't impact most of DCA. This was something a few years ago at the time of our last sunset that was sort of fresh, and everybody was unclear about the ABC test and what's an independent contractor and what's not. We as a board don't regulate anything in this space, and this issue really doesn't have much to do with our activities. Issue 16 has to do with the relationship between optometry and ophthalmology, which we could probably, you know, spend the rest of the day talking about the history of that. But importantly, what we're talking about here is, again, related to what we were mentioning in issues 12 and 13 about how we are seeing some entities use creative corporate structures and other types of contractual relationships to not be regulated by the board. We have retailers with dozens of locations out there, again, where consumers can walk into and walk out of with a prescription. And again, it's unclear whether they've ever seen a licensed person at all. BPC 655 is a very important statute that comes into play here because it establishes the landlord-tenant relationships that can exist between optometrists and ophthalmology and dispensing opticians and health plans and optical companies. And as was mentioned earlier in response to prior issue 13, we do have a definition of optical company. Again, that is an entity that is selling these products to the licensees, if you will. But in what we're seeing in this specific situation is a retailer with publicly accessible locations where consumers walk into, and then it's invisible to them that the space is subleased. Right? They have no knowledge of that, and they're walking into this place, walking out of it with a dispensed prescription product. I don't think this board wants to go down the path of regulating optical companies because that's a big universe of entities out there that supply and provide and manufacture equipment. But when an optical company is co-located or subleasing space where an eye exam is happening or where a consumer is showing up to receive optometry services, that might be a situation where registration should be required. And so that's what we're talking about in this issue. Don't have proposed language a scheme to design that, but we want to have that conversation and see if there's a solution here. Question 17, prior issues, has to do with what we're doing about childhood vision screenings and the importance of what we would call not a vision screening, but a comprehensive eye exam, because they are not the same. And I think, as this board knows, this is a commitment and a priority that we have here. We do have a video that we've published on our website. I present that video at every presentation and talk that I give, because I think it's very important that the audience that we're speaking to understands what this board's perspective is about comprehensive eye exams and how that's very important for children to receive. You know, we've also dialogued with Children's Now Coalition and others on this issue. We were asked, I think, last time about whether there's any data or information like that that we're aware of, and I don't think we are aware of data that tracks, for example, the rate of children that get these vision exams before they enter school. That's probably more on the schools than it would be on us. But again, this is a very important issue and something that this board cares a lot about. The next question was mobile optometric offices, and the current response is not in blue, so I apologize for that, but there is a current response for this issue there. As I mentioned earlier, MOO was approved by the Office of Administrative Law 2 days ago. So we now have the regulatory program in place, and we're looking forward to implementing those business requirements in the near future. The next issue was COVID waivers, and we don't have any further update. Our answer this time around is consistent with our response last time. Same with the next issue. Issue 20 had to do with immunization. Following the last sunset in 2020 and 2021, optometrists got expanded immunization authority for COVID vaccines. We implemented that. So our current response is consistent there. The next issue was any technical cleanup, and earlier today we approved as a board a few technical items, so we will include those actually at new issue 9, where it's more appropriate to put them. So those are the prior issues and the current responses to them. I know there's a lot in there, and I'm happy to take questions and comments from the members on that item.
Very good. Any comments from the audience? Let's open up any comments from the public. Section 9.
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you would like to participate, click on the question mark inside of the square, type the word comment and send it to all panelists, or click on the outline of a hand. There are no requests. Would you like me to close the Q&A?
Yes, please. We'll move on to section 10, new issues.
All right, so section 10 is new issues. I'm only going to focus on the new issues that we didn't already deal with as part of agenda item 5. So in agenda item 5, we dealt with new issue 3, new issue 4, new issue 5, new issue 8, and new issue 9. So I will be talking about the other new issues. The first new issue is something that was mentioned a few moments ago, having to do with the scope of practice of optometry in this state. It is not up to date with the education and training that optometrists receive, not just in the 3 California schools, but in all of the accredited institutions. Under federal law, accredited institutions have to prepare students for licensure in any state. And so that means that the institutions are providing instruction and training in activities that are not authorized under the scope of practice once licensed. They have to do that again because the scope of practice in other states does authorize it. So we would like to have this conversation with stakeholders in the legislature as we move forward into sunset review about how we can modernize the scope of practice of optometry. It's important not just for access to care reasons, which we talk a little bit about in this issue. So for example, we have more than 1 million veterans in the state of California, probably the state with the largest amount of veterans. Because optometrists in California are not allowed to perform lasers and things like that, those veterans are not authorized to go to optometry for those services. They have to go to ophthalmology. Well, this contrasts with recent federal law changes, which say that for the first time, your license issued in one state is good in any state, license portability. But you can only use that license in the other state consistent with that state's scope of practice. So a military veteran licensed OD in Oklahoma who has a more advanced scope of practice than a licensed OD in California, who under military orders has to move to California, is eligible under federal law for what's known as a portability license, essentially. They do not have to have a California license to practice optometry. However, their ability to practice optometry in California has essentially been downgraded because the scope of practice in California doesn't authorize them to perform the same scope that they could in Oklahoma. So that's an issue. And I think we should have that conversation as we move forward in the sunset review about how we can modernize the scope of practice for optometrists so they can provide that frontline care that they're trained and educated to provide. In this issue, we've also put the specific courses that the 3 California schools are teaching right now that teach these exact procedures and techniques. There's also a national exam specifically for laser and surgical procedures. So it's important that stakeholders and the legislature knows that. And we would probably want to see have this conversation in a way that is consistent with how it's been done in the past. And in the past, what that looked like was the legislature recognized that the education and training that was happening in the optometric schools and colleges was up to date and current and safe, and licensees were competent to practice. And so the statute said that if you graduated on and after a certain date, you were qualified. It also allowed for a secondary pathway because there was obviously those people who graduated before those dates. I think it would be important as we move forward and have this conversation that two-step pathway be preserved. So we look forward to having that conversation. The next issue is new issue 2, which has been alluded to earlier a few moments ago about supervision. What does that look like? The information in this new issue is similar to the information that we just discussed in prior issue 12 and 13. However, we do have there is a suggested definition that is included here. And I think we would look forward to working with associations and stakeholders and the legislature on this issue and seeing if there is a way to come up with a definition that protects consumers so that they are knowledgeable about the services that they are receiving. So that is new issue 2. New issue 3 and 4 we already dealt with, as well as new issue 5. New issue 6 has to do with the caps that exist in the law on the number of offices, both physical and mobile, that providers are able to have. Up until a few years ago, an optometrist was limited functionally to only having 2 offices because they had to be physically present 50% of the time. That changed in 2019 and increased that functional limit of 2 to an actual limit of 11. So an optometrist or their partners or corporation can only have 11 offices, 11 shingles, as I've been referring to it, physical locations. A couple years later, mobile optometric office was enacted, and it says that during the first renewal period, you can have 12. Under the mobile optometric office statutes and regulation program, only a nonprofit corporation or charitable organization is eligible to acquire the registration as a mobile optometric provider. does it make sense for a corporation to control more locations where optometry is practiced than an optometrist itself can control? Is, I think, a good question to ask and try to answer. It's also, this would also be really the first substantive time. The cap of 11 has been in place for some time now. And so we should have a conversation about that, about both numbers. Should we have two different numbers? Should we increase those numbers? I don't pretend to know what those answers are, but I think we should have that conversation because there are differences. Again, a mobile unit is limited to 12 during the first renewal period. After the first renewal period, no cap at all. There can be as many mobile units controlled by that corporation as they apply for. But again, an optometrist is always limited to 11. We want to have that conversation. The next issue is there may be, issue 7, there may be a conflict between existing statute found at Business and Professions Code 2541.2C and the federal contact lens rules. Essentially, that conflict might be that under our state law, there is language that says a provider has professional discretion as to when to release certain types of contact lens prescriptions. The federal contact lens rule does not appear to provide for any such professional discretion. And so there may be a conflict there. If there is a conflict, the simple solution would be to just point to the federal regulation. That's how it exists on the spectacle side, the spectacle statute for prescriptions. And when you release them, point to the specific federal regulation. So every time the federal regulation is updated, we stay up to date. We don't have that same citation cross-reference, if you will, on the opticianry side. So that would be a solution if there is a conflict. And those are the new issues. Happy to take questions, comments, feedback from the members on the new issues as presented.
I have a comment on new issue 2.
Go for it.
New issue 2, if you scroll down below subsection 10, there's a full paragraph, the law does not. The next paragraph, I think, is the one, the lack of definition for the phrase. And then if you just, that first sentence, the lack of definition for the phrase, and then it cites to BPC 2544, also contracts with a definition. You might have meant contrast.
That's exactly what I meant. Thank you for catching that.
Okay, that was it.
Perfect, thank you.
So mine are more of just a comment, especially on new issue 2 and 3. New issue 2, definitely. And so I am licensed in Oklahoma. I even went and extended a certification to PRK. And so I've been doing that, and I've done it years in Indian Health because we fall under that federal umbrella, and so we've been doing it without any adverse effects, no problems there. And so kind of a comment that I would be really interested in somehow, some way being able to continue that conversation from firsthand experience that I have done those procedures without any issue. And then for issue 3, kind of more recently, I've really gotten into telehealth, and it does have a lot of positives.
Can I interrupt you real quick? Sorry to do that. I think you're referring to issue 1 and 2, not 2 and 3.
1 and Oh, yeah, sorry.
You refer to 1 and 2, not 2 and 3. Gotcha. Okay, I just want to make sure I was tracking.
So 1, yes.
Yeah, 1, the way you were talking about Oklahoma was issue 1. Okay, gotcha. Okay.
So, and 2, yes, definitely. I got into telehealth, and it does have a lot of positives that I enjoy, but in the spirit of consumer protection, there are things that need to be regulated. Like the first company I did get involved with, I am no longer involved with them because it was very much so they just wanted my signature. And so there are issues there, and I, again, don't really have any answers, more just saying I do recognize that and would love to somehow continue in that as well, because as far as access, I've been, like, right now I'm in a different company that it's a different approach, and I don't sign anything that I don't actually see the patient for in real time and actually talk to them. And so the approach is much better and the format is much better. And the access is just amazing. Like as far as like the diseases that have been caught, and I'm able to see patients in multiple states in any given day. I'm reveling in that now. And so it's really great in that respect. But yeah, I have seen the other side of it where it is just, they want your signature and they're just wanting to sell glasses. So, just so more comments, just like I kind of have personal investment in those issues and would love to continue to help that out however way I can. But yeah, more of a comment than really a question or anything like that.
You know, I certainly don't think that this board wants to stifle the ability for folks to access care, right? Regardless if that's telehealth or in person. But it's really trying to capture that other side that you're talking about the consumer protection side. You know, and I think this is, from what we're seeing, less an issue that's happening in private optometry or ophthalmology offices. It's more in these retail type establishments. And like you said, I don't know the perfect solution here, the wordsmith exactly, but that's the issue that we want to go at. You know, there are retailers with dozens of locations out there that people can walk into. You're driving by, you might have an eye problem. Oh, there's an eye store, an optical place, and go in there, and an unlicensed person can't help you, right? They're not going to be able to treat that or deal with that, but a licensee could. Right. And so, again, that's not a situation that would exist at a private doctor office because there would be somebody there. But in these other establishments, we're not seeing that. And that's where the concern's coming from. So we don't want to stifle access to care. We don't want to do any of that. But we want to make sure consumers are protected. Yeah.
Yeah, I just have a couple comments, not specific to any of the numbers, but in terms of the decreasing licensed optometrists, right? So there are many causes of that, but some of the things that I think are contributing is our scope of practice in California is limited. You know, the licensees in California should be able to practice to the fullest extent of their training, right? And they should be able to coming to California and practicing as they would in Oklahoma and 20 other states. So I think that does have an impact because you know, I'm an associate professor for SECO and Western. So we get students coming to our offices every quarter in training. And that's one of their considerations. You know, they're learning how to do all these procedures and advanced procedures. And if they stay in California, they're very limited. So that is a factor in deciding where they end up moving and getting licensed. So I've noticed a lot of California graduates going to other states. So number one. Another reason is reimbursements in California are very low for eye care, lower than any other state, especially for Medi-Cal. So, you know, that impacts what practice can pay a new graduate because their reimbursements are lower and they're higher in other states because the reimbursements are higher. So that also limits the number of new grads wanting to stay in California. You know, access to eye care, you know, you mentioned Central Valley where I live is very limited, and other parts of the state are too. Any rural place in California is going to be underserved. So, you know, that is all those sort of directly impacting access to care, the number of optometrists. COA was really proactive in trying to get reimbursement rates higher for Medi-Cal. I'm not sure if you want to speak to that later. But there's a proposition on the ballot, Proposition 35, which is protecting Medi-Cal. But if it passes, it's actually going to have a negative impact on reimbursement rates for optometrists and Medi-Cal. So if it passes, then there's a very strong likelihood that reimbursement for Medi-Cal eye care or optometrists will not increase, but they will for ophthalmologists. So it comes right back to that ophthalmology, optometry battle again. So, you know, there's just a lot of things going on out there in the eye care field, especially related to California optometry. Anything else from the board members? Oh, really good stuff. Okay, I'll open up for public comment in the room. Okay, let's open up for public comment online.
Moderator, can you open up public comment online, please?
Not saying anything.
This is the moderator. Sorry, technical difficulties again. It's that day. Q&A is now. The Q&A is now open. The instructions are on the screen for your reference. If you would like to participate, click on the question mark, type the word comment, send it to all panelists, or click on the outline of a hand. I see no request for public comment. Would you like me to close the Q&A?
Yes, please. Before we move on to the future. Sure. So members, that concludes the review today of the draft sunset report. Next steps. Next steps would be, we've got some edits to make, pursuant to the conversation we've had today. We will make those edits. There are still, as we've also talked about, some additional information we need to put in the report, like the national exam data, for example. Next steps from here is going to be doing that work, and then we will bring this report back to the board at the December meeting, and that will be the meeting where we will need to entertain a motion and hopefully approve it. As was mentioned earlier, this report is due by January 6th of 2025. Following a hopeful approval of the report at that time in December, we will again work with DCA Publications to make a nice cover and sort of beautify the report, if you will. So that's kind of the next steps from here. We don't have to entertain a motion to approve it today because I think we still have a little bit more work that we need to do on it. So we will be looking forward to bring that back here in 2 months and reconsider the report at that time. So that's a little bit about what we'll plan to do.
Chair Linda, did you have any closing remarks on?
No, just thank you. Sure. Thank you. Of course. Yeah, this is a big undertaking.
Big report. Yeah, for sure. I still need to consult with President Garcia on that. Yeah.
Okay, item 7, future agenda items. Are there any members that wish to bring up any discussion items for future agenda?
Yes, I guess the dispensing optician committee.
Okay.
What the future of that is going to be. And is that something that you addressed it? It's been addressed on the sunset report, but nothing technically needs to be done further.
Yeah. Well,
to that report being submitted, does it?
Yeah, no, I think nothing in the report needs to, but I think
I know it was mentioned in the report a couple of times.
We should have, to your point about bringing, the future of the DOC as an agenda topic at a future meeting. We should talk about it, talk about, the history. The committee hasn't met in a few years. So some of the new, I'm being generous, maybe at least 2 or 3 years probably. So we've got newer members that may not understand the whole history of the DOC. I think we can have that conversation, right?
If it's necessary, I know it keeps coming up, but it hasn't met and functioning. You guys we've been functioning well. I don't want to say without it like that, but
yeah, there was a brief time period where we didn't have an optician member on the board, and during those time periods, I need an optician, right? It's in those moments, I think, where the DOC can be very impactful. But I also, since I have been with this board, there has been no DOC. So I also have no experience of engaging and working with it. And so I'm probably not the most knowledgeable to inform that question as well. But I would love to have that conversation as a board and talk about what it looks like, what you all think the future of that committee looks like. That would be an appropriate conversation to have.
Yeah. I'll just kind of chime in. I think it's important to have a DOC. It is a different profession, and it is, it should have its own committee. If you have your own issues, right, that are separate and different than optometry. So it'd be nice to someday have that back again.
I think that was one of the issues is that there's only one optician on our board, but opticianry is a large part in California. So having the DOC was another way to have more representation.
Okay.
our licensees in optometry.
Yeah, I think that's also part of the challenge is finding enough qualified, interested folks. You know, I have been trying to be an evangelist for public service over the last 2 years almost, and mentioning this aspect every place that I go and in every audience that I can find. I have not had a lot of opticians express interest. I've had lots of optometrists express interest for the open spot, but just haven't seen that same, you know. So if you know any, Ruby Garcia, if you know anybody knows any, you know, qualified folks, send them my way. I'd be happy to chat with them about what public service on the board and committee look like.
Maybe that can be a future article in the Spectacle.
It could be another article in the Spectacle. Yeah. It's been in there. Yeah, we have, you know, right on our homepage, I think we have a right across the top, right? I mean, we have tried, we've had DCA help us out a little bit in the past on that too. It's hard, it's been hard to find enough folks that are interested. And then folks that, hopefully you'll stay on the board longer than a year. That's the other aspect, is the few folks that we have hadn't stayed long. So then it's hard to build a relationship. It's hard to build rapport. It's hard to build knowledge base as a board member if you're not on it for very long. So yeah, it's a great future agenda item.
Any other future agenda items on the board? Any
board visits? You get to go places, and I know Ms. Garcia mentioned visiting a school.
Yeah.
And I talked to you. Hopefully, I'm going to the women's prison in Vacaville in November to visit their optical program.
Is that the new one, Vacaville?
Program's been going. It used to be, it's called Chowchilla, yeah, now they call it Valley State Prison, but they have a thriving optical program. They are PIA Optical, if you've ever heard of that.
Yes, yes.
And the women are pretty amazing. They put out a lot of glasses.
I would be interested in attending with you if that's a possibility.
Absolutely.
So we can work on that together. In terms of taking this board collectively to an optical program, I think I mentioned it earlier today in the report. Maybe
October. You said maybe October.
I think October next year for the optometry program, for an optometry school. I think sometime in the spring might be a good target for an optician program. And I could not believe what I saw at Sac City yesterday. It was amazing. I visited the Sac City optical training program yesterday. It was incredible. It was a very nice facility. Just a great, I mean, I saw it a year ago when it was still being built out and they had carpet still in the wet lab. Now that's all gone and modern equipment, and it looks great. And I know you and others, and Member Club and others have interest in doing that. They haven't been ready for a visit. I think they're probably ready now. So we'll look forward to doing that probably in the beginning of the new year. Yeah.
Yeah. Any other comments for new agenda items from the audience? If we can open it up for any future agenda items and public comment.
This is the moderator. The Q&A is open. The instructions are on the screen. If you would like to participate, click on the question mark, type the word comments, send it to all panelists, or click on the outline of a hand. No requests. Would you like me to close the Q&A?
Yes, please. Okay, we have no closed session items, so that brings us to the end of the meeting. A very productive meeting. Thank you, everyone, for your attention, for your hard work on these projects. Meeting adjourned.